Good morning, everyone. Chair Crandall, I just want to let you know that we are ready when you are.
Okay, it is 9 a.m. So it looks like we will, if everyone's ready, we'll go ahead and call this meeting to order. It's
Don't worry, that's not an omen.
That's not right. Yeah.
Just use it like that.
Yeah, we'll just use. Gotta have laughter. It's just for show, everyone. All right, well, calling this meeting to order here on March 1st, 2022, and I'd like to see if there was a moment of silence, and I have one as well. And Supervisor Sabatier, do you have one as well? Or?
We'll see what you guys have.
Okay.
Thank you very much. Last week was a very difficult week for the Board of Supervisors, especially specific members. And I would like to read today, with permission from Supervisor Crandall, the obituary for his mother, Evelyn Louise Crandall. Evelyn Louise Crandall was born June 21st, 1960 in Ukiah, California. Patti Wati Squeeze, Strawberry Shortcake, Peppermint Patty, hopefully I said that correctly.
Yeah, you did.
Wheezy, Red, and many other nicknames that were lovingly bestowed upon her in her lifetime, as she was an open-hearted, loving friend to all. As a child, she traveled the states with her siblings and father, eventually landing in San Jose, California. She graduated high school and obtained her cosmetology license in 1980, while simultaneously working as a beautician and raising her children as a single mother. She then moved up to Robinson Rancheria in Nice, California in 1988 upon the reestablishment of the tribe. She served on the Robinson Rancheria Citizens Business Council, Robinson Rancheria Gaming Commission, the Robinson Rancheria Housing Commission, and the Lake County Tribal Health Board. At the Robinson Rancheria Bingo and Casino, she rose through the ranks to become the bingo manager throughout the 90s. She was also an active member of the Robinson Tribal Elders Committee. She was actively walking the path of the Red Road. She loved Club Bingo, the San Francisco Giants, and the San Francisco 49ers. The Creator called her home at 4 a.m., February 20th, 2022. She was preceded in death by her mother, Evelyn Tootie Peak, her father, James Red Crandall Sr., and her brother, Myron Gorbett. She leaves behind siblings James Crandall Jr., Susan Duncan, Gwen Alvarado, Troy Crandall, Julie Whedon, Joyce Peak, Jolene Crawford, and Lisa Peak. She leaves behind her children, Frederick Portillo Jr. and Eddie E.J. Crandall. Grandchildren, Dayani Crandall, Eddie Crandall Jr., Isaiah Crandall, great-granddaughter Navana Kadaya Rose Gallardo, and many nieces and nephews and grandnieces and nephews. And that's the end of the obituary. I do want to add a personal note. I never had the honor of meeting your mother. I believe I accidentally did upon our swearing in into office here on our first meeting together. But I've gotten to know you over the years of service, and the kind and wonderful human being that you are only tells me who your mother is, especially being raised by a single mother. So today, I would like to honor your mother with a moment of silence.
Thank you, Supervisor Sabatier. I appreciate that. I'm going to add one for Jose Moak Simon Sr., a Middletown Rancheria tribal elder who passed on February 21st, 2022. And he was a member of the tribe, a District 1 constituent, also was the general manager for the Twin Pine casinos for years, and I know a lot of people who worked there and commented about his ability to stay focused and always working hard, keeping everybody on task. And he leaves behind, his son and his daughter, Supervisor Simon, and grandchildren, and lots of family, of course. And he's reunited with his wife, Karen. And that's, I think we all have to find solace and peace in some of those things at times. And so Yeah, I would like to offer this moment of silence as well for Supervisor Simon. And do you,
And I would just like to add, asking for peace for the people of Ukraine.
yeah, okay. Supervisor Pyska, would you lead us in the pledge?
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Thank you. And so we are at consideration of extra items not appearing on the posted agenda. And it looks like, I'll just read it off. Extra item 4.1, consideration of extra item, agenda item, and consideration to reschedule the annual governance workshop for the week of 3/7/2022. CAO Hutchinson, would you like to add on that, or?
Yes, it came to my attention yesterday that Supervisor Simon would not be available to participate in the governance workshop you had scheduled for Thursday, and I'm asking that your board select a new date today, if at all possible. And so you can take this up anytime you wish. If you choose to take it up today, it can be taken up later, if you like.
Okay.
I move to approve the extra item with the reason provided.
Second.
So I have a motion and a second.
We need to open up to public comment.
And we'll open it up to public comment first. And let me look on. Thank you, Vice Chair. I'm not seeing any hands up either place, so I'll bring it back to the board for deliberation. We have a motion and a second. Johanna, can you please conduct the roll call?
Yes, Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes. Yes.
and Supervisor Crandall.
Aye.
Thank you.
All right, and then we'll take that up a little later when we have the opportunity.
Thank you.
And so now we will move on to the consent agenda item. These items on the agenda are non-controversial, and we usually pass them with one motion. However, if there's something that is on this agenda that anybody would like to discuss or seek further discussion on, they can pull it. And so I will open it up to the board and see if that's the case here. Yes, Supervisor Sabatier.
I will speak for more than just myself. I know that I've spoken with our CAO. I know I wanted to pull for further discussion item 5.1. I also, because of an item further on in the discussion, wanted to pull item 5.3. I believe, and I'll check with the CAO, that one would be for a future agenda item rather than a further discussion.
Yes.
All right. Okay, thank you. Okay, I will open it up for public input to see if there's anyone that would like to pull anything. I don't see anyone in the chambers. I'm looking online, and I don't see anybody with their hands up as well, so we'll bring it back to the board for action.
Mr. Chair, I move to approve the consent agenda 5.1 and then 5.4 through 5.13.
That would be 5.2.
I mean 5.2, and then 5.4 through 5.13.
Second.
So I have a motion and a second. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Aye.
Thank you.
Okay, it looks like we've passed those, and it's not 9:15 yet, which is our first presentation. So,
Public input.
Mr.
Yeah.
Chair?
yes.
In the event someone may be waiting for agenda item 6.6, which is the 10 a.m. item, I conferred with Supervisor Pyska and the Lake County Cannabis Alliance folks yesterday, and the request has been made to push that forward to the March 8th agenda, and so I thought it might be helpful for anyone waiting, if you agree that it should be pushed, that anybody that's waiting could be told to come next week.
Okay, And I think so what will ensure everyone knows that 6.6 will be an item that's pushed to March 8th next week.
And it will be a timed item that we'll determine before we post the agenda, so people will know when to show up.
All right,
Thank you.
thank you. And Vice Chair Scott has reminded me about public input, and so we'll open it up for public input. Is there anyone in the chambers that would like to conduct public input? I'm not seeing anyone. However, we do have somebody on Zoom. And so if you would like to unmute yourself, and you have 3 minutes to speak, let's ensure that this is about something that's not on the agenda. If it is, we will guide you to that time and specification when that will be discussed. Go ahead.
Yeah, good morning, everybody. This is Tom Slate. Eddie, I'm sorry to hear about your mom. I lost my mom in 1998, so I think I can relate to that. On February 15th, I referred to the microphone for the video recording being cut on me while I was speaking respectfully at a supervisor meeting January 10th, 2012. I stated there is, of course, a switch the chair has, or at least used to have, that can cut the microphone to the video recording and broadcast. What I spoke to happened 10 years ago. In a predictable pattern from when Bruno does not like what he hears, he interrupted and drew attention to himself and away from the other, in this case me, and made a comment that, not surprisingly, made no sense. He was not only out of order, but confused the issue and muddied the water by changing the subject from what happened 10 years ago to what he claimed are recent conditions. What he said on the surface made no sense. Bruno stated boldly and with an air of great authority, "I just want to say I have no knowledge of any button at the chair level that controls the audio. There is absolutely zero controls other than your own microphone in front of you." Well, consider if something happened 10 years ago and Bruno was just hearing about it, of course he would have no knowledge. How absurd, how completely, absolutely, totally absurd. It might seem to make no sense, but it does. It is bullying behavior, although in Bruno's case, a clumsy, obvious blustering attempt, but it is bullying behavior just the same. Bullying, including verbal attacks and insults to members of the public in public, has been ongoing for far too many years at the Lake County Board of Supervisors. On the video record, Chairman Eddy responded with a flippant, condescending remark. He stated, "They're allowed to project, or whatever the case, or whatever, that's fine." No, Eddy, it's not fine. So I was projecting? What was that supposed to mean? Do you even know what that word means? Where were you 10 years ago? I explained that I have the video and written evidence, an email from Anita Grant. Based on my extensive prior experience, this is no surprise to me. I was marginalized and disrespected by you, Eddie, and a new, inexperienced supervisor spouting nonsense prevailed. Again, no surprise to me. You may recall that a few weeks back, I read some of the guidelines from the Board of Supervisors Code of Ethics. I tried, although I thought it would be futile, a waste of time. Well, it was a waste of time. No surprise here either. So that's all I have to say for today. Have a nice day.
Is there anyone else that has public comment? Okay. Not hearing any, we'll go ahead and move forward from public input to our, well, we have a couple minutes for our timed items. What can we?
7.5 looks
All right, let's do 7.5. Thank you, Vice Chair Scott. It looks like we have 7.5 is, thank you. It closed on me. Got it. Consideration of the following advisory board appointments: Glenbrook Cemetery District and Lake County Vector Control District. And it looks like we have, from the Glenbrook Cemetery District, one vacancy. Applications received to Eric C. Patrick. And from the Lake County Vector Control District, Charles Leonard Jr. And so with that, do we have any other, any discussion at the board level? Supervisor Sabatier?
I will just say that Chuck Leonard's been, hello? Chuck Leonard's been active on the Vector Control District Board for quite a long time. Appreciate him resubmitting his app and continuing to serve on that. So looking forward to approving that today.
Okay. Okay, looking for public input. I don't see any in the board chambers, and don't see any here as well on Zoom. bring it back to the board for action.
Mr. Chair, I move that we approve Eric Patrick to the Glenbrook Cemetery District.
Second.
I have a motion and a second. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
okay, and Supervisor Crandall.
Aye.
Thank you.
And then we have the Lake County Vector Control District position as well.
And Mr. Chair, I move to approve Charles Leonard Jr. to the Lake County Vector Control District.
Second?
A motion and a second. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Aye.
Thank you.
All right, we are at 9:15. So 9:15 is our 6.2 presentation of proclamation appointing Georgina Maria Guardado as Lake County Poet Laureate for the years 2022 through 2024. And Supervisor Pyska will conduct the proclamation.
The Board of Supervisors, County of Lake, State of California proclamation appointing Georgina Marie Guardado as Lake County Poet Laureate for the years 2022 to 2024. Whereas the County of Lake recognizes the contributions of poetry and the arts for enriching the literacy and cultural attributes of society, and whereas the County of Lake acknowledges the relationship between poetry and political freedom in the exercise of free speech in forms recognizable by people all over the world, and whereas the County of Lake recognizes that poetry represents one of the most enduring forms of expression and contributes to the historical continuity of civilization, and whereas the function of the Poet Laureate is to encourage poetry and writing among Lake County residents by stimulating literacy and creativity in spoken and written form, and whereas the Poet Laureate of Lake County is designated to represent the Board of Supervisors at civic and cultural events. Now, therefore, be it wholeheartedly proclaimed that the Board of Supervisors of the County of Lake does hereby appoint Georgina Marie Guardado as the Lake County Poet Laureate for the years 2022 to 2024, passed and adopted this first day of March 2022.
All right. Georgina, I see you online. Would you like to say a few words?
Yes, thank you so much for this proclamation and for taking the time. I know poetry is not necessarily the highest priority given the pandemic, but it is one way that our community is getting by, especially artists and writers. Many newcomers who are realizing that creative writing and poetry can give us some healing and a way to process all that we're going through. So I appreciate you taking the time and all of the work that the Board of Supervisors are doing collectively during these hard times. And I wonder if I could read one poem to commemorate.
By all means.
Thank you. So two other things that I like to focus on as Poet Laureate is diversity and animal rescue as well, since we have some issues with that in Lake County. So this poem kind of ties those two together. Other. Year after year, day after day, seconds after seconds, canines multiply like rabbits in a springtime frenzy. Two of them have found their way on my now saliva-lined sofa, sleeping soundly, sighing softly as they inhale safety and exhale their worry in the comfort of their stable home. She, named after an African country, Kenya, motherland, for her strength. He, named after a Seminole word, Miko, chief, ruler of my heart. Both breeds considered a threat. The Mexican-born German in her, the fight in him, all existing in me. My Mexican gene seen as a threat to America, home of the brave and the drug-sniffing Latinx. The underdogs we all are, human, animal. I see these big magical beings as holy, like I see my brown skin, a reflection of earth, of soil, of how we are all multiplied in this world, how we start out as cells and blood, and there is no brownness or whiteness or fear in the beginning, how we all enter this world to a first breath as science, as magic, how some of us go from there to needing to be rescued, from being discarded as nothings, as others, how we then rescue each other. Thank you very much.
Thank you. That was very good. Thank you very much for that.
I had a question for Georgina.
Yes.
I believe that you either were elected or are involved at a federal level for poets. Wondering if you can give us a little bit of what you've been doing and what that all entails.
Yes, thank you for asking. So in June of 2021, I was appointed as a Poets Laureate Fellow with the Academy of American Poets. The Academy is the largest national supporter of poetry and the arts, and they have the most funding available as well. So as part of my fellowship, I had submitted a project proposal for my community. What I chose to do, since we're so rural in Lake County, is to bring visual representation of poetry to the people. So I've been doing that by means of poetry boxes. You may see some of those up in Kelseyville, Clear Lake. There's 2 in Middletown. Also little poetry libraries, which are like the free libraries, which will be stocked with poetry books, and also murals for communities who wish to have murals. So those 3 options are available, and they're going up around the county, different locations. So far we have Clear Lake, Middletown. We have some in the works for Upper Lake and Lakeport. I'm still looking for areas in some of the more spread out regions like Clear Lake Oaks and Nice. There's also a lot of information about it on my website, which is georginamurraypoet.com. And I'd love to continue working with the Board of Supervisors and many other organizations and businesses to bring this project around the county. It's fully funded by the Academy, which is amazing.
Thank you so much for representing us on a national scale like that.
Thank you.
Appreciate that.
Thank you for your contributions, Georgina. Is there anyone that would like to, that has public input? And I don't see anybody in the chambers. And does anybody see what's going on with Zoom? Mine just went off for some reason.
There are no hands at this moment in Zoom.
Okay, so we'll bring it back to the board. Thank you again, and you have a great day. And we will now bring it back to the board to move on to item 6.3, which is the presentation of proclamation designating March 2022 as Social Work Month. And Vice Chair Scott will read this proclamation.
Board of Supervisors, County of Lake, California proclamation designating the month of March 2022 as Social Work Month. Whereas the social work profession for decades has been dedicated to improving human well-being and enhancing the basic needs for all people, especially the most vulnerable among us, particularly during the global pandemic. And whereas this year's Social Work Month theme, The Time is Right for Social Work, embodies how social workers rose to meet the most pressing challenges of all of our lifetimes, the COVID-19 pandemic. Even as our nation continues to grapple with systemic racism, economic inequalities, global warming, the need for improved health care and other crises, and whereas social workers have always helped people overcome issues such as death and grief, and help people and communities recover from increasing natural disasters such as fires, hurricanes, and earthquakes brought by climate change. The social work profession is one of the fastest growing careers in the United States, with more than 715,000 social workers today and nearly 800,000 professionals expected to be employed as social workers by 2028. And whereas social workers possess the necessary expertise to assist our nation in some of the most demanding concerns, including their health and well-being, not only during the pandemic, but for all times. Social workers work in all facets of our society and meet people no matter where their circumstances and empower them to live their fullest potential. And whereas social workers at Lake County Department of Social Services assist a variety of populations, such as the elderly, dependent adults, and risk families and children. Now therefore it be proclaimed that the Lake County Board of Supervisors hereby declares the month of March 2022 as Social Worker Appreciation Month, in Lake County. Recognizing the social worker's profession makes society a better place to live and by advocating for positive change, and encourages all citizens to consider social work during the month of March and throughout the year. Passed and adopted this first day of March 2022. Thank you. I'm sure you have something to say. And I think Sam wants to get a picture.
Oh, okay. All right. Well, we are here today. First, I would like to say thank you to all the social workers in Lake County. Social Services is not the only employer of social workers here. And the last 2 years, social workers have been very busy, busier than they typically are. Today, I have here with me Amy Shemansky, who is the Program Manager for Adult Services, Public Guardian, and In-Home Support Services, and Mary Pagan, who is the Program Manager for Child Welfare Services, where we also have Adoptions and Resource Family Approval Program. Mary is also the manager for that program. And we have Social Worker Supervisor Sherry Delatorre, who's seated. But I want to thank them especially for showing up today. The social work programs at the department are core programs, very important for the community and for the work that we do here. We are extremely grateful for their dedicated, hardworking, and compassionate work that they do, and they continue to collaborate with each other and with the community, both on a professional level and with those people that they work directly. And so I'd like to say thank you very much.
I also know that we have some child welfare social workers and staff on Zoom, I hope. They were going to Zoom in today. And so I've been a social worker here for Lake County Child Welfare for 22 years. And I thought the best way to honor my colleagues, my fellow social workers, not just in child welfare and adult services, but all throughout the county. We have amazing social workers in the medical field, in the tribal community, and in private industry. There are a lot of us here in Lake County. So ironically, I'm going to read a poem. And here we go. Being a social worker means you'll never be bored. You will always be frustrated. You'll be surrounded by challenges. So much to do and so little time. You will carry immense responsibility and very little authority. You'll step into people's lives and you'll make a difference. Some will bless you and some will curse you. You will see people at their worst and at their best. Gotta take a breath. You'll never cease to be amazed at people's capacity for love, courage, and endurance. You'll see life begin and end. You'll experience resounding triumphs and devastating failures. You'll cry a lot. You'll laugh a lot. You'll know what it is to be human and to be humane. So I just want to say to my fellow social workers, we see you, we value you, and we appreciate you.
So,
Take that mic and bend it down.
Got to set it up for the short girl. Thank you. So, hard to follow that up, Mary. That was beautiful. I'd just like to echo the sentiments of both Crystal and Mary in that social work is bigger than just social services. But on behalf of those of us doing it at that level, I'd just like to thank them all for what they do. I came into the system as a social worker. I always felt a deep connection to the work. That sense of satisfaction when you can help somebody on an individual level get past a crisis that they're going through, and a sense of maybe pride and accomplishment for doing that, and the pride that they hopefully all feel even when you can't solve it. We all know there's a lot that it's not always a happy ending, and you don't always get to fix something or have the achieved results, but the social workers stick with it and they keep doing the job. And I've been out of the field for a little over 3 years now, but I still feel a deep connection to the work and to the people doing it, and the challenges that they've gone through the last 2 years during the pandemic. It's different. We do the work different now than we did before, but they've stuck
with it through the changes, and I think that the clients are still being served. There have not been any gaps there, despite the fact we may be working from home or over phones and doing things a lot different. Staffing challenges, all those things. And so I just appreciate what the social workers do, and I'd feel a little remiss if I didn't add on the fact all of the other people whose title might not be social worker who are part of that, whether it's the supervisors or the aides or front reception who touches every case. They have to have some credit here too. So thank you to everyone for all they do, and we appreciate you.
All right.
Almost everybody. There we go. Almost. There we go. Cool. Smile. One more and one more. Thank you.
Thank you very much, and thank you for the work you do. For me, it's a special thing when we honor those who work for humans, other humans who need our help. At times, no one really thinks about the social worker because they're too busy giving all of their energy to the people that are in crisis. And so it's very helpful amongst each other to make sure we care for ourselves as well, because you can get overwhelmed and you have to kind of let some of that, purge from you. So again, your work is boots on the ground. Nobody really thinks that, but I know it. So thank you again. Is there anything anybody would like to add to that proclamation? Supervisor Sabatier?
I just want to say thank you very much for bringing this proclamation. Absolutely agree. Thankful for those that go out and help people, no matter who they are, what walk of life they come from, or what they may have endured. And I appreciated the last comment, because a lot of times we thank social workers, we thank code enforcement, we thank law enforcement, but without the support staff behind all of that, coordinating and helping out in the background, the real job would be that much more difficult to be successful in. So I appreciated those comments and very thankful for the work that you all do.
All right. And it looks like do we have anyone that would like to add any public input to that? If not, we'll move forward to our 6.4. And that item is sitting as the Lake County Housing Commission, consideration of housing choice voucher program administrative plan for 2022 and signing of the annual civil rights certification, HUD form HUD 50077-CR. And it looks like we need Kathleen Augulin, if you're here.
Yeah.
Okay, she's here online. And so she's on the Housing Commission with us.
And Mr. Chair, our Housing Program Manager, Kelly Page, is online, and I believe she will present this item.
Okay, Kelly Page.
Will Kelly present this next item? Thank you.
All right. Kelly, the floor is yours.
All right. Good morning, everybody. My name is Kelly Page. I am a program manager with the Department of Social Services. That is the agency that oversees the Public Housing Authority and the Board of Housing Commissioners. You all sit as our board as well. And today we are seeking approval, as we do every year, of our proposed 2022 administrative plan. This is basically our policy and procedure manual for the Housing Choice Voucher Program. Each year we update this plan based on revisions from HUD and a few programmatic changes at the local level that are needed. This process begins on January 31st. We had a public meeting to go over the proposed changes. Attendees at that meeting on the 31st included Board of Housing Commissioner members, the Resident Advisory Board, and Housing Commission staff. Prior to our 31st meeting, we had a 45-day public comment period where we had posted the proposed plan, all 500 pages, and anybody who cared to comment, make a suggestion on our plan was welcome to do so. We received no comments during the 45-day period, and during the session we had on January 31st, we received no suggestions or requested changes. So the plan, as we're presenting it to you today, was proposed to be approved as written by the board and then submitted to HUD. Excuse me. In addition to the plan, the Housing Commission is also requesting the chair of the Board of Housing Commissioners sign the annual Civil Rights Certification form. This is required by HUD, and it's basically a statement that verifies we will perform our duties as the Housing Commission as requested by HUD. This is also a yearly form that has to be signed and submitted. And I did include with the items submitted to the board just a basic summary of the changes that were made. As I had stated, we went into detail during the public hearing on those changes. And if any board members have any questions on any of those, I would be happy to answer any that you have.
All right, thank you. Is there any questions? Supervisor Sabatier?
I appreciated, I took part in the meeting on January 31st just to listen in, to learn as much as I could. I know that on this board we've talked oftentimes about the housing voucher and the need in our community. It was great to find out the help that has been provided during COVID-19 for some of the emergency vouchers that you've received, and also the vouchers that we have for our local veterans here as well. Very thankful for the work that's happening. Always wishing we could do more. I do know that housing is one of our problems, because even if we did have more vouchers, having more houses or landlords that approve those types of vouchers is also something that's needed. So looking forward to getting some of our housing projects completed, whether it's in the cities or whether it's in the county, but thankful for the work happening.
Thank you, Supervisor. We try really hard. We do have limited resources, but if there's a landlord out there who isn't working with us but would like to, please contact us. We're always looking for landlords who are interested in the program. We can give you all kinds of information.
If you're online landlords. Do we have any other comments from the board? No. Public input. We will open it in the chambers, and I don't see anybody coming up. I do not see anybody on Zoom either raising their hand. And I will do a 3, 2, 1 to bring it back to the board for deliberation and action, unless there's something else from anybody.
Mr. Chair, sitting as the Board of Housing Commissioners, move to approve the Housing Choice Voucher Program Administrative Plan for 2022 and authorize the Board Chair to sign the attached form, HUD 50077-CR, Annual Civil Rights Certification and Board Resolution.
Second.
So I have a motion by Supervisor Sabatier, second by Supervisor Pyska. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier, or Commissioner Sabatier?
Aye.
Sorry about the background noise. Commissioner Scott?
Aye.
Commissioner Pyska?
Yes.
Commissioner Crandall?
Aye.
And Commissioner Oakland? I hope I said that right.
Ogulin?
Is that
Commissioner Ogulin?
Sorry, thank you.
I don't believe that we got a formal vote from Commissioner Ogulin, did we?
No, I haven't heard it. Commissioner Ogulin, are you on, can you hear us? I don't think she hears us. Commissioner Ogulin, can you hear us? If you can, are you a yes or no vote on the current? I'm not seeing. Okay, so what's that? It's on their end, okay.
I have a logistical question for Ms. Grant. Since there's already 4 votes, does it require a vote from Commissioner Ogden? I'd love to get a vote from her, but can we move on without her vote?
Normally, the point of having this position filled is to allow for this vote, so technically you could.
Microphone.
Technically you could, but it's not advisable given the significance of this position on the commission board.
She gave a thumbs up. Commissioner Augulin, did you give a thumbs up for a vote, a yes vote? I think she did, but I'm going to go ahead and type it in.
So, Mr. Chair, what I might suggest is that you just put the vote on hold, allow Kelly Page to assist Ms. Ogulin in resolving whatever this issue is, and come back online and do the vote shortly. Would that be, oh, she's giving a thumbs up
She gave
now.
a thumbs up, yeah.
Okay. So that's a yes vote.
So it's a yes vote.
All right.
All right. Thank you, Commissioner Augulin. We've seen it 3 times, so third time's a charm.
I would like for clarity that we try to get her on the phone. A thumbs up can mean a lot of different things with all the conversation that's happened. I know that it probably is, but I'd rather make sure that we hear a vote rather than see a vote for something that might just be a thumbs up, I can hear you.
Okay, yeah.
So, I think she may have resolved her audio issue.
Yes.
Oh. So you have a yes on the vote?
All right.
All right, no worries. Thank you.
That works.
Should we just call for the roll call again while we have? Johanna, please conduct the roll call.
Okay, this time might be better anyways. Okay, so Commissioner Sabatier?
Aye.
Commissioner Scott?
Aye.
Commissioner Pyska?
Yes.
Commissioner Crandall?
Aye.
And Commissioner Ogulin?
Commissioner Augulin?
Aye.
Okay. We got it. Thank you, Commissioner Augulin. And so we'll close that item now that it's, Supervisor Sabatier.
I apologize. I made a mistake. Whenever you want to allow it, I would like to re-review. I missed one item in the consent agenda that I forgot that there was one error that we needed to fix.
Okay.
So whenever you feel that it's comfortable for us to do so, I'd love to go back over that.
Okay, it looks like we might have time a little later, so. Okay, we will now move on to our 6.5, which is our 9:30 item. Consideration of update on COVID-19. And it looks like we have, let me see here how we have this going. We'll go ahead and give the floor to our public health officer and our public health director. I think, right?
Yes, I assumed that Director Portney wanted to make a brief introduction. There he is.
All right.
Yes. Good morning, Board of Supervisors. Good morning, community. Today is a special day for the health department and for our county. I'll leave introductions and direction moving forward to Dr. Pace. But I just wanted to pause and appreciate this milestone and transition. Dr. Gary Pace has been an advocate. He has been a leader, and he has been gracious in the time that he has spent with the county as serving as a public health officer. And we have been blessed, and we're grateful to transition into the new. And as Gary Pace departs, and we appreciate him for his service for the county, we also like to welcome Dr. Eric McLaughlin, who is going to be coming from working with us from Vegas to serve our community at large as our incoming public health officer. So without further ado, I will pass the mic to Dr. Gary Pace and allow Eric to introduce himself accordingly.
Hey, good morning. Thank you, Jonathan. Good morning, Mr. Chair, and to the supervisors and to the community. I'm Gary Pace, the interim public health officer here in Lake County, and going to give the COVID update. Kind of the way I was thinking about doing this was I'd give the update, talk a little bit about the future direction in dealing with COVID that the governor's talking about, try to clear up a little bit of the confusion around masking and then kind of hand over the reins to Dr. McLaughlin, who officially starts today. So we'll kind of hold off. He'll be the icing of the cake at the end of the talk here. So first off, I want to take a moment and acknowledge just how hard the last couple of years have been, really. And, you know, it was 2 years ago, right about now, that we were starting to hear about COVID, and the first shutdown started on March 17th. So, you know, basically 2 weeks from now. And over 120 people have died in Lake County now related to COVID. And, you know, my condolences to Supervisor Crandall and Supervisor Simon about the losses in their family. And, but also, you know, there's been a lot of illness, a lot of lives disrupted, kids not getting the education that they normally get. And, you know, it's just been a huge deal. And, you know, especially feeling the recent loss of lives in the context now when we're talking about getting back to normal seems a little kind of hard and part of just the conflicts that we're having with all this. And so, you know, it's really been rough, I think, for a lot of folks. And so the latest surge is getting better, and we'll look at the data now. And to talk about that, thank you, Matthew, for doing this. So this is put together by Sarah Maricos, our epidemiologist, with one slide that I put in myself, so she might grit her teeth if she saw my version of it, but we'll get to that. So this is the current look in California. On the left is the case rate. You can see it's dropping down quite a bit. The death rate is starting to slow down, but as always, there's a lag time from the cases to the deaths. And then the testing positivity in California now is 2.9%. Next slide, please. So this is the health system impacts. This is really what we're starting to look at a lot now, is how to prevent overwhelm of the hospitals. And you can see at the right here that that's starting to drop off in California quite a bit. Next slide, please. This is Lake County, again, healthcare impacts. So the hospitalized patients on the left, the ICU patients on the right, dropping. It's always a little hard to gauge this because of the way our transport is, but anyhow, the curves are reflecting what we're seeing elsewhere. Next slide, please. This is the tests and the test positivity. So then the left is the number of tests, which, you know, the numbers are going down, not too surprising. On the right is the test positivity. So you can see in Lake County, we're at 10.1 test positivity, and in the state, it's 2.3%. So we're still seeing a much higher, 4 times the rate of positive tests in Lake County as there is in the rest of the state. So that shows that we're still actively having community transmission. Next slide, please. This is the case rate and death in Lake County. Again, you can see the dropping and the positive trends overall. Next slide, please. So this is the one I put in. So basically what I wanted to do is just get a little context here on what we're seeing. And, you know, this can lead to a whole lot of conversation, but it just seems important at this point in the pandemic to pay attention to this. So on the left-hand side are neighboring counties here. The second one are the population rates, death rates, and the vaccination rate. And these are from different places, so the vaccination rate is not going to exactly correlate with what we see in our later data, but I just got the graph off the state site and had all the counties at the same time. So if you look across at Lake County, we have 65,000 people, 128 deaths attributed to COVID, and then the vaccination rate is 54%. So Tehama County has a similar population, but the death rate is 30 people more. The vaccination rate is 10+% less. Mendocino County has 20,000 people more than we have, yet they have 16 fewer deaths, but a significantly higher vaccination rate. Napa County, twice our size, about the same number of deaths, but 20+% higher vaccination rate. Sonoma County, you know, that's just what, 8 times the size of Lake County, but only 3-4 times the number of deaths, and the vaccination rate again is really high. So, you know, there could be a lot of reasons explaining this, and we could spend a lot of time talking about it, but I think it's it's very useful to start tracking some of these things and seeing, especially Mendocino County, who's very similar to us in a lot of ways, and yet they have a much lower death rate than we have. Next slide, please. So these are the age group, the cases in February. The most important thing to notice here is if you look at the younger ages, there's 34 per 100,000 in the 5 to 11 and the 12 to 17. So these are the school age kids, of course. And then the next groups are the parents of the school age kids or the folks that are working out in the community. So next slide, please. So this is, again, the age range. We'll go ahead and pass over this. This one's, go ahead, next slide, please. So this is the race and ethnicity issues. So if you look at probably the easiest way to look at this one is this middle, this first column here, February 1 to 27. And if you look at the percentage of cases in the white community is 60%, the Latinx community is about 26%, and then the Native American community is 10.6%. So this is roughly correlates with the percentages in the community. The Latino community is probably 20 to 22% of the population. The American Indian population is probably 4 to 5%. So, you know, we're seeing some inequities here, some higher proportions in the Latino and the Native community, but you know, it's roughly correlating with the population at this point. Next slide, please. So similar, this is basically illustrating the same thing. Next slide, please. So next slide, please. This is the vaccination coverage in the Lake County. And so basically amongst eligible Lake County residents 5 and older, not quite a third, not quite 2/3 of the folks are fully vaccinated. So this is, and this is lower than the state. The state rate is about 70%. So this is an issue, and this is probably contributing to the higher impact of spread and the higher impact of the death rate. Right now, we are the 5th highest county in the state in terms of the number of cases per 100,000. So there's only 4 counties out of the 58 that are higher than us in terms of the number of cases per population. Next slide, please. This is by age group. So again, if you look at the kids, the 5 to 11 and the 12 to 17-year-olds, we're much lower than the state average. This line that goes down the middle is the state average. So those two, and then the 18 to 49-year-old, which tends to be the parents of the younger kids. So all these groups are vaccinated at lower rates than we would like and lower rates than we're seeing as the state average. I think that's it, though. So, thank you. So, you know, I think overall we can see that things are getting better, but we're still dealing with a lot of cases here, and we are in kind of this tricky area of how to balance everything out. So I wanted to go into how we're looking at things moving forward, especially with the governor's discussion last week about all this. He's mainly looking at how do we anticipate moving forward where we still are being careful, but we're preparing for future surges. Historically, the surges have been coming every 6 months or so since the beginning. So we've been having about 2 a year. And so, you know, this next one may be coming at the end of the school year, or probably more likely end of the summer when we're starting to talk about going back to school. How bad is it going to be? Is it going to be a new variant? We don't really know. Was this one the last surge? I mean, eventually they'll probably stop, and so we don't really know any of this. And so I think our job in public health is to try to allow movement and as much normal life as possible, while also trying to prevent the bad outcomes from coming. So you know, and I think really we actually have a lot of experience doing this in Lake County. If you think of the fires, we have to live during fire season all the time, where we go ahead and live our lives as best we can, but we also are kind of ready. If you start smelling smoke or you start seeing the smoke plumes, we know who to talk to and how to prepare. The red flag warnings, we're getting used to dealing with those. And so I think this is all very similar kind of approach, where you're living with a certain amount of caution and preparedness, but you're also not letting it completely suppress your whole form of life. So the governor's plan is to dial things down when the case rates are less worrisome, and then to go ahead and prepare and for when the surges do come and when we start seeing some changes. And one of the ways we're doing that is wastewater monitoring is going on now. So we are starting to monitor the sewage, because that's an easy way to pick it up really early, even before the cases start really spreading in the community. But the focus on preparations, the three things the governor's really suggesting is during the lulls, in between the surges, which is what we're entering into now, to stockpile testing supplies and PPE is the first. Second is to really try to get people vaccinated, especially those people in the most vulnerable communities. And there's a particular emphasis now on school-aged kids to try to get them vaccinated. And then the third piece he's really focusing on is combating disinformation, because there's so much hesitance in getting potentially life-saving vaccines and using safety measures like masking. So really starting to try to approach the disinformation tactics straight on. I want to talk a little bit about masking, because there's been a lot of changes in the last week or so, and it's somewhat confusing. So I just want to kind of highlight the main points and how to kind of organize the thinking about this. So again, just for context, there was a big study came out in the British Medical Journal. It was published in November of 2021, meta-analysis of 72 studies that showed that masks work. So from the data is very clear that masks do work. I think that's partly probably what we're seeing with the differentials between the counties, the vaccinations and masking. So in this study, they saw a 53% reduction in COVID infections attributed to the masks. And many other studies show similar findings. And of course, the quality of the mask matters. But this was a big kind of reputable study that is probably going to be setting the bar for where we're going. The CDC just came out with new guidelines on Friday. Some people are probably aware of that. The aim is to help communities live with the virus and get back to some version of normal while preventing severe disease so as not to overwhelm the hospital. So that's the big public health focus now. Not so much preventing cases, but it's we've kind of are moving past that and moving into a phase of really trying to prevent the severe disease that causes the hospitals to get overwhelmed and not able to provide care. This CDC guideline, so this is federal CDC, is really for individuals. It's not about how states or counties should move forward. So if you're an individual and you're not sure what to do, you can look at the CDC guidelines and get some clarity about what they think you should do. Basically, they're looking at each county's status in terms of risk, and then they make recommendations based on that. So if you're a medium risk or a low risk or a high risk county, based on the CDC's gauge, it tells you how to think about masking. And again, to emphasize, 70% of the counties in our country are at medium or low risk right now. Lake County is currently high risk and very, very firmly in the high risk county. And there's a map online, if you go to the cdc.gov or other places, that shows each county, and they're going to update it weekly, I think. So if you're in a low risk county, there's no need to wear a mask. They feel that it's safe enough, the transmission rate is low enough that it's not necessary. This is masking indoors. Medium risk, if it's a medium risk county, you should consider wearing a mask if you're at high risk of getting severe disease. So if you're immunocompromised or elderly or something like that. And then if you're in a high risk community, which again, Lake County is right now, they recommend wearing a mask if indoors with other people. So that's the CDC guideline for if you are wondering about yourself or your family, you can go look at the CDC guidance. Under their guidance right now in Lake County, they would recommend wearing masks indoors around other people, whether you're vaccinated or not. Now, California came out with new guidelines last week, and they're changing some of it again today. So as of today, they've listed the indoor masking rule for unvaccinated people. So if you're in the state of California, the indoor masking guidance until today was if you were vaccinated, you didn't have to wear a mask indoors. If you were unvaccinated, you were supposed to wear a mask indoors. Today they've changed that. So in California, there is no mandate to wear mask indoors unless you're in a high-risk area, which is a healthcare facility, public transportation, correctional facilities, or homeless shelters, or schools. Schools are the other ones, and we'll talk about that in a minute. But so basically, as of today, in the state of California, you don't need to wear masks unless you are in one of these higher risk areas. The exception is local jurisdictions can be stricter. So Lake County, we're following the state guidelines, which is pretty much what we've done since the beginning. So if you have a question about what to do in Lake County, you can look to the CDPH guidelines, the California Department of Public Health guidelines. And at this point, there are no indoor masking mandates in Lake County, except for what the state guidance is, which is in these particular high-risk areas. Mendocino County, on the other hand, is continuing to require indoor masking. So I was up there this weekend visiting some friends, and when you go into a store or restaurant, you're expected to put a mask on, and there's only about 3 or 4 counties in the state that are doing that, but you know, it's part of the confusing puzzle that's here. So, okay, so we have the federal, we have the state, and we have the local. So those are and they all kind of are doing different things, and it makes it a little bit confusing. But then there's the schools. The schools are a whole nother story. The schools in California at this point are mandated masking in the schools as part of a high-risk situation. After March 11th, just yesterday, the governor came out and said after March 11th, masks will no longer be required in schools or childcare settings. So that would be the end of next week. The masking mandates will be lifted for the schools and childcare settings. Local school districts can continue to mandate masks, and you know, I'm sure that'll be part of the discussion in the coming weeks. We didn't really know what they were going to say. We just knew they were coming out with some guidance yesterday. So I know all that's fairly confusing, but hopefully that helps sort out the differing perspectives. So just a couple more things. You know, I want to emphasize the importance of getting the vaccinations. Vaccination is really, really important, and at this point, with the surge kind of dropping down, it's a really good time to get vaccinated in preparation for the next time around. Vaccines are clearly the key for us decreasing transmissibility and preventing the severe disease, at least it has been so far. If you're having trouble finding where to get vaccinated, go to our website, Lake County Public Health, or contact us at the COVID Warm Line, and we can help point you in the right direction. The state is providing some resources with a community vaccination site, and there's some plans for targeting some of the school-age kids that are coming soon. But given the changes with the approach and how we're moving into this post-surge kind of model, some of these resources are going to disappear by the end of March. So I really encourage people, if you're needing to get vaccinated still, go ahead and take advantage of these resources while they're here. So overall, the push is to try to move forward towards a more normal lifestyle, but continue to be cautious and ready to ramp up as needed. So moving on to the next chapter here. So I'm really happy to say that, you know, there's a new team that's come together in the health department. This is a really exciting and kind of an energetic, smart team that's committed to addressing the health needs in the county. And Mr. Portnoy, JP goes by right here on the screen, is going to be the leader and a very dynamic guy with a lot of ideas, and we're really lucky to have him. Eileen is our new director of nursing. We've been here maybe 6 months or so. She's got a lot of experience and really great. Mike Marsh is helping us with some emergency preparations, and there's going to be a new PIO coming in soon, a public information officer, and now Dr. McLaughlin, who's up here. So I want to say a few things there, but I also just want to acknowledge that there's been some really hardworking and committed folks that have been with the department for a long, long time and through this whole COVID surge. And, I really want to acknowledge all the work they've done and give my deep appreciation for all of that. And their experience and institutional knowledge is going to help with this transition to the new team. And I want to say personally how much I've just appreciated working with all the folks in Lake County during this incredible time. I mean, it's been pretty amazing, and we've gotten so much support from the county staff and from Carol Hutchison and Matthew and the whole team, and through the health department and all, volunteers, the MRC volunteers, folks coming out and helping us vaccinate, the different hospital and clinical settings around it, is the fire guys, it goes on and on and on and on, how much this has been such a broad community effort to really pull this whole thing along. And we don't get a lot of outside help usually, and people really step up. And it's been really a privilege for me to be here and be part of this, and so I want to thank you all. Now to Dr. McLaughlin. He's a really interesting guy, a lot of relevant training and experience with wildfire responses, and he's been around the world, different places, got a lot of experience with pre-hospital transport, and he's worked with public health in a lot of different settings. So he's bright and has a lot of energy, and I think we're going to be really going to see a lot happening here with him and JP working together. So today's his first day on the job, and I'm going to be around a little bit to help if needed, but I don't really expect too many calls. I think it's really, really incompetent hands here. And so I'm going to sign off and hand over to Dr. McLaughlin if he wants to say anything before we go to the board and the public comments. So thanks.
We have to give you a round of applause, Gary, for your service. So thank you. Dr. Eric, the floor is yours, sir.
Yeah, thanks. I'll keep it brief and really wanted to acknowledge Dr. Pace. Exemplary leadership in a truly arduous times, not only for public health, but for medicine and for our communities. He's been an incredible resource that I've been happy to take advantage of in my transition coming on. He's been a nice guy. He seems to take punches and hits and keep smiling. And I think that is probably what is one of the most successful factors that he possesses. He's been a wealth of knowledge to me, and I'm certainly keeping his phone number in my contact list should I need to phone a friend. I also wanted to echo his statements about the importance of vaccinations. He presented a slide that I think he was maybe a little flushed about when he put up during his presentation, and I thought that slide was very important. It showed what we see backed with science of death rates not only correlating but causing death rates. We see communities with higher vaccination rates have less deaths. And I think that's an important take-home message. I think this is part of the impetus for some of the changes we're seeing and the shift to how we are fighting COVID as communities, as states, and as a nation. So I really wanted to draw further attention to that. I echo his sentiments on CDC and California Department of Public Health guidance. We're very appreciative to have that work being done, and we intend to follow those. So I really like, again, to thank Dr. Pace for his counsel, his guidance, his incredible stewardship during the very arduous last couple of years of COVID. And he's given me some big shoes to fill, and I look forward to the challenge. I'm incredibly excited to be working with our new team, Ms. Van Cleef, Mr. Portney, Ms. Hutchinson, Ms. Baker, a lot of others on the call that I may have hopefully not excluded too much of. And I really look forward to this opportunity, and I want to thank the trust the board has placed in me to keep people healthy and safe and get on with our lives and hopefully improve them. So I want to say thank you again for that. And again, Dr. Pace, cheers.
Welcome. All right, introductions are made. An overview of the health department, our current state of COVID has been done. And I would like to pass the microphone back to the Board of Supervisors.
Thank you, Director Portney, and thank you, Dr. Pace, for these years, and working with you has been a pleasure for me. not just here, but also when I was working simultaneously with the tribe. You know, the help in that realm was a very big time, and it's something I'll always remember and cherish. And your availability, your empathy, your diligent work, greatly appreciated, and I'm glad that we have someone that you can pass that on to. Seems like he'll fill those shoes just fine, and I just want to thank you once again, and I'll go ahead and I don't know who was first, but I'll go with Supervisor Pyska.
Dr. Pace, thank you so much for your time here, and thanks for hanging in this last year. I know it was difficult, and you led with empathy and compassion and your heart, and we're always going to be grateful for your time here, and really, really thank you. And welcome, Dr. McLaughlin. I'm really excited for your first day, and you know, we have a solid team, and so we're going into this new lull with a new team, and the support of the staff that's been here throughout the last couple of years. So it's a new day, and I'm excited, and want to just give one more thanks and shout out to Dr. Pace. Thank you so much.
I just want to make sure that I gave my thanks also to Dr. Pace for sticking with us for the last 2 years. We really appreciate everything that you've done for Lake County, and I believe we are better because that you were here to help guide us and protect us. So thank you.
Supervisor Sabatier.
Thank you very much. Before I get to Dr. Pace and Dr. McLaughlin, I want to talk a little bit about some of the information that was provided. One is last week I did a presentation on the data. All the data that I provided from CDPH was the correct data to provide. I accidentally said something that I shouldn't have said, which was off the top of my head, and that was the death rate for the flu. I said 0.1, it's 0.01, so times 10 on that information. But the main basic information I was providing was the CDPH data on case rates and death rates, and so all that information was correct as it was directly from there. So I apologize for that misinformation that was provided last week. I wanted to make sure and correct that because I do not want to make people believe things that are not correct. I also want to highlight some of the information that is available online at CDPH about vaccinations to support what is there. Number one, we've been talking about, and we've kind of been hearing that continuing to talk about vaccinations is useless. Those who don't want it aren't going to get it. And when you look at the state website, you still see the number of unvaccinated population decreasing on a daily basis. It's still happening. So I think the conversation still is relevant, and I think it's still useful. And I want to bring some of the data information that I obtained looking at our surge even for Omicron, which many of us were led to believe that the vaccinations were becoming less and less relevant in protecting us. And while it might be less than before, it's still very relevant today. And so, for example, for the population of 5 million in the state of California that are unvaccinated, the deaths per 100,000 was 95, approximately 95. For those that are vaccinated, not boosted, just vaccinated, it was 11 per 100,000. And for those that were boosted, it was 4 per 100,000. Now, when you go from 95 to 11 to 4, that is a drastic, huge difference. And to me, that's data that shares that there is a level of protection that still exists, and it's still very relevant for us to have these conversations. Also, I wanted to touch on the information that Dr. Pace provided about kind of comparing us. And I'm not going to go too far because it's not a discussion we should have today, but I know that we've had discussions in the past about our health metrics, and I think our health metrics have a lot to do with how we cope and how we deal with COVID. We are one of the most unhealthiest counties in the state of California. That does not help us to have to be on the starting line of dealing with COVID to begin with. And I hope that one day we stop being reactionary to COVID. We were forced to. We couldn't ignore it. And that we can become proactive again in working towards better health metrics, which can lead us to better outcomes for everything, not just focusing on COVID. Because I looked at the map again of health metrics, and we're just a bright red.
Sorry.
We are a bright red county surrounded by other different colors of varying results of health metrics. We need to do better, and I hope that we can get back to that type of work. And I know it's difficult because, again, we can't ignore COVID. It's definitely been something for us to pay attention to. Dr. Pace, appreciate that we were able to keep you for the length of time that we lost you, we got you back, and I appreciate that. It's been unfortunately a long trek to be able to find ourselves a new public health officer to take your place. Appreciate that you have been a continuous rock, not swerving around the public opinion, public the language and the comments that we hear every day during our meetings, that those things have not changed you from looking at the data and looking at the science. We can't have public health show us anything other than that. And then afterwards, we can make our own decisions afterwards based on the information provided. But that public health is science. It should not be changed based on public opinion or popularity of the content. So I appreciate you being very steady throughout these difficult times. I don't think we've ever seen public health be placed in such a spotlight and such a pedestal ever before. I don't even think the AIDS pandemic did what COVID did to our country and our communities in separating us and splitting us apart. So definitely a difficult time, both interesting and terrifying all at the same time to have to deal with it, not on the front lines, but as a leader making decisions, and those decisions matter. Dr. McLaughlin, welcome, and looking forward to you taking on the role of PHO and bringing us some of these changes that we're going to deal with to make our county a healthier county. And that's working with our hospitals, working with all of our health partners together, because we're not going to do this on our own. We're going to do it all together. So looking forward to it, and thank you for the presentation. And again, Dr. Pace, thank you very much for your service to this county.
All right. Thank you for that. Looks like we have all the board has spoke, and so we'll go ahead and open this for public input. My Zoom went down, so if you can assist me on that.
We have phone 4627.
Phone 4627, if you can unmute, and you have 3 minutes.
Hi, good morning, everybody. This is Tom Slade again. To take off with where I left at public input, and I really don't like making these phone calls. I get kind of, it's, I'd rather call up and say nice things. I really would, but I noticed there's no mention of early, and what I'm going to talk about, I'll be very brief here, has been talked about numerous times at prior meetings. So no mention of early treatments like ivermectin, HCQ, even zinc and vitamin D. And I just find it's irritating to me, but I guess I shouldn't use that word, but when people say, anybody who doesn't agree with one side, it's misinformation on the other side. So I'll just read this briefly. The unquestioning, from my perspective, the unquestioning lockstep COVID policy is the latest in a long, disgraceful Board of Supervisors history, and that's what I'm talking about from before, going back years. From my perspective, as a COVID exaggeration, discredited PCR-based fear campaign, and major harm caused by politically motivated and imposed unwarranted rules crumbles, horrific vaccine injuries and deaths mount, and people realized they were duped, that the Board of Supervisors, despite all the information, including well-recognized life-saving treatments publicly disclosed to them at the Board of Supervisors meetings, have and will soon be recognized as a colossal, spectacular, tragic failure. And time, over time we'll find out. But I just want to put this out there. People can put whatever they want, but we'll see in time. So thank you. That's all I have. Bye.
Thank you for your comment. Is there another person that has their hand up?
Julia Bono.
All right, Julia, please unmute yourself, and you.
Hello, can you hear me?
Yes, go ahead.
My name is Julia Bono. I have degrees in scientific research. I'm here today to speak firmly against the use of mask mandates to prevent the transmission of SARS-CoV-2 virus that causes the COVID-19 disease. I am pleased to hear that mask mandates have generally been dropped in California, and I would urge Lake County to immediately follow suit in that regard and to eliminate school mask mandates immediately. In contrast to the single study Dr. Pace mentioned, my extensive research on this topic has turned up hundreds of peer-reviewed studies that show the surgical ear, loop masks are generally ineffective against preventing the transmission of tiny virions, including those on the order of 0.125 microns, like SARS-CoV-2, that can only be seen with an electron microscope. In addition, the mask packages specifically state that the product will not provide any protection against the COVID-19 coronavirus or other viruses. Even the better N95 face masks show limited effectiveness against COVID-19 due to its small size. Using and mandating the use of such masks to prevent COVID-19 is therefore not justified by science. Since the SARS-CoV-2 virus is so tiny, using a standard surgical face mask to stop its transmission is a bit like trying to stop a swarm of bees with a chain link fence. Not only are such masks ineffective against COVID-19, but various studies show they cause breathing issues, acne and headaches, reduce empathy and body language communication, have other adverse psychological impacts like causing excessive fear and result in antisocial behavior. Mask mandates are therefore especially unnecessary, odious, and heavy-handed public policy approach in response to COVID-19 that mainly serves to increase fear levels and reduce physical and psychological wellness among the population. Such policies seem especially problematic when valid, peer-reviewed scientific research seriously questions whether the easily obtainable surgical face masks are actually effective in preventing the spread of SARS-CoV-2. Forcing healthy people to wear face masks when in public to prevent spread of a microscopic virus also contributes to a shortage of such masks for the very medical professionals who do actually need them to protect against transmitting bacterial infections. Also, I still hear vaccinations being pushed by Dr. Pace and Eric McLaughlin, but the reality is that they cause harm and have no effectiveness in preventing new COVID cases, so they give the vaccinated a false sense of security. The vaccines also have a higher death reported rate of roughly 87 per million than the current Omicron strain of the SARS-CoV-2 virus that only kills around 9 per million cases. Basically, unless you're over 80 years old or have serious diet-related comorbidities like heart disease, cancers, diabetes and obesity, or if you're a tobacco smoker, it does not make sense to vaccinate against COVID, since your odds of survival are generally greater with Omicron that confers lasting immunity against 6 structural proteins instead of just the single spike protein that the mRNA vaccines code for. You can also notably reduce your chances of suffering from chronic diseases and therefore from experiencing moderate to severe COVID by following a whole food
Finishing, if you could finish up, yeah.
Okay. Again, I want to repeat my last sentence. You can also notably reduce your chances of suffering from such chronic diseases and therefore from experiencing moderate to severe COVID-19 by following a whole food plant-based diet. Thank you.
All right, thank you for your 3.5 minutes. Go ahead, Supervisor.
I hope I don't sound like a bully by responding. That is not my intention, but I do want to say we do not have the ability to say to schools what law to follow or not follow. It is not a Lake County rule, it is a state rule because schools are state functions and they have their own boards. So to ask us to make that change is just not possible. Number two, I appreciate that Ms. Bono brought it up. I meant to correct Dr. Pace. He said there was only the CDC and the state guidelines for masks. We do still have our public facilities in Lake County mask mandate. I wanted to make sure and provide that in case there was some confusion that might have been taken away.
Thank you, Supervisor Sabatier.
And next is phone 1113.
Okay. Oh, there is another one? Okay. Let's see. If you're on, can you please unmute, and you have 3 minutes.
Yes, hi. Can you hear me? This is Dr. Will Tuttle.
We hear you loud and clear.
Okay, good. Yeah, so I want to respond to what we heard earlier, several things. The disinformation campaign, of course, I feel that this is what we're trying to do here is stop the disinformation that's coming from the captured agencies that have been captured by, over the decades, by big pharmaceutical money and are causing devastating impact on our population. I really do agree with what some of you were saying, that the money, the over $2 trillion in the CARES Act, virtually none of that went to actually educating people on how to eat healthy food, how to get proper exercise, how to get fresh air and have a positive life with healthy and happy and harmonious relationships. These are really the keys to health. Everything that's been done, all the money has gone into ramping up fear and alienation and having people wear masks. 70% of all the toxins in our body leave through our breath. And so you're going to be having people wearing masks, recycling their toxins, getting sick, locking down businesses has been a big problem, and keeping people separated. And everything has been to make people less healthy. We also have this ludicrous and very, I think, damning 2-week delay. So in other words, if someone gets vaccinated, then they're not considered vaccinated until 2 weeks later. And so you have all these people dying who have been vaccinated, but they're considered unvaccinated because most of the deaths happen within 2 weeks when people get this shot. And it's very toxic with the spike proteins and the graphene and all that stuff that's in there. So this is a very dangerous and damaging situation that we're in, and we have very reputable doctors and epidemiologists who have been censored and silenced, like Dr. Peter McCullough, who is one of the most respected people, always was, and in medicine, and he has these 5 truths, which I think I've sent it to you in an email, but I think it's very important to just be aware of that. The 5 basic truths. Number 1 is there is no such thing as asymptomatic spread of disease. This has been well documented and recognized for decades that healthy people do not spread disease. Therefore, there's no new evidence to refute this. So therefore, number 2, there's no need to wear masks. There's no need to practice social distancing, to close or limit schools or businesses, or to test people or to track people. Iceland, which is in the middle of a upsurge in cases, has just removed everything. There's nothing. They're not doing anything anymore because the Department of Health said it's the worst thing to do.
You can finish up, please.
All right, I'll stop there. Thank you very much, but I just think we need to question all of these things that we're being told. Thank you.
Thank you. Is there anybody else that has any public input on the Zoom? I don't see anybody.
There are no further hands up.
All right, so I will close public input at this point. We greatly appreciate your insight. We'll keep that in consideration. And again, thank you, Director Portney, Dr. Pace, and Dr. McLaughlin for today's discussion, and we appreciate you. All right, so I'm going to go ahead and entertain a break. We will come back at 10:35, let's say. Okay. Yeah.
Oh, I just wanted to remind everybody that our 10:30 item.
10 items, excuse me.
Oh, 10.
The
cannabis presentation will be postponed till next week.
All right, item 6.6 will be postponed till March 8th. And therefore, we're moving on to our 6.7 item, which is presentation of Central Valley Flood Protection 2022 update. And I'm going to go ahead and pull open the memo so I can properly hand this off to Deputy Director Delagiannis.
Hello, good morning, Board of Supervisors. Thank you so much for having us today. My name is Marina Lajanis, and I am the Deputy Water Resources Director for the Lake County Watershed Protection District. I'm excited to be joined here with some friends from the California Department of Water Resources, and we are here today to be giving you all a presentation of the Central Valley Flood Protection Plan, also known as the CVFPP 2022 update. So the CVFPP is California's strategic blueprint to improve flood risk management in the Central Valley. So what this strategy lays out is three main ideas, and what these ideas are is the prioritization of the state's investment in flood management over the next 3 decades, the promotion of multi-benefit projects, and the integration and improvement of ecosystem functions associated with flood risk reduction projects. So with that being said, I am super excited to pass it over to Jason Sibley, who's a supervising engineer with California's Department of Water Resources, Division of Multi-Benefit Projects, and Jason serves also as one of the leads for the CVFPP 2022 update. So with that being said, go ahead and take it away, Jason.
Thank you for that very nice introduction, Marina. Board members, thank you very much. Again, my name is Jason Sibley with the Division of Multi-Benefit Initiatives. And myself and my colleague from the Central Valley Flood Protection Board, Darren Soon, are here today to brief you on the progress of the 2022 CVFPP update. I want to thank you very much for giving us the time to join this meeting and provide this briefing. We will have a short PowerPoint presentation that I believe my colleague Laura Kaplan is going to share for us. And then we'd like to leave a little bit of time for questions and remarks that you may have. So first, I'd like to introduce my division manager, Steve Rothert from the Division of Multi-Benefit Initiatives, to provide a brief introductory remark.
Morning, and thank you for this opportunity to address you and provide a brief update on the Central Valley Flood Protection Plan 2022 update. This is a great opportunity for us to listen to your concerns and interests and better understand how we can develop the plan in a way that benefits your county. And so we're here to listen, and we look forward to the conversation this morning and ongoing as you get a chance to dig into the plan and provide your comments and recommendations in the future. So thank you for your time. Appreciate it.
Thank you. Thank you very much, Steve. Now I will hand it over to Darren Soon from the Central Valley Flood Protection Board.
Thanks, Jason. Good morning, Chair Crandall, members of the board. Darren Soon, I'm a legislative and policy advisor with the board. We appreciate you taking the time to hear us today. We look forward to receiving your comments on this draft plan. And with me today is one of our board members, Joe Countryman. I'd like to turn it over to Board Member Countryman for some opening remarks as well. Thank you.
Good morning, board. As a civil engineer, I had a lot of experience with flooding in your county, and I would really like to have the county participate with us and give us a bottom-up understanding of what the flood issues are in the county that we can help with, or at least help, with the formulation and coordination with the Corps, for instance. So I'm looking forward to working with you guys as much as we can, and I'll turn it back to Darren.
Thanks, Joe. I'm going to go ahead and turn it back to Jason.
Thank you. Thank you all very much. If we go to the next slide, please. So the slide we're showing here is our acknowledgements for local flood management partners and projects that are underway or being planned in Lake County, including repairs for the damage caused from the 2017 storm events, as well as the Middle Creek flood damage and ecosystem restoration project. As you may know, we began the flood management planning effort for the CVFPP Central Valley Flood Protection Plan in 2012 and have updated once since 2017. The plan was legislatively mandated, as well as updates every 5 years on the 7s and 2s. So the first one was in 2017. We are currently creating the second update to the plan. Each time we do this, we've been expanding our outreach to include more partners, including more county boards of supervisors covering a larger geographic extent with each plan for our flood management system. This time in 2022, we have conducted outreach to 15 county boards of supervisors. We are currently connecting directly with 4 counties for the first time this year, including yourselves in Lake County, as well as the boards of supervisors in Glenn, Tehama, and Stanislaus County. So it's a great opportunity for us to continue to reach out to additional counties within the region. We are glad to be here today to strengthen our partnership with you and look forward to receiving, as my division manager said, receiving your input on the CVFPP this year and in the future. We would like to thank the Mid and Upper Sacramento Regional Flood Management Planning Group for encouraging us to reach out to Lake County with this round of outreach. Additionally, we'd like to thank some of your public works staff, including Scott De Leon, Marina De Legianis, and Yulia Osatroff for being so welcoming and helping us to get up to speed on flood management background and projects for Lake County as we prepare for this briefing. Next slide, please. The CVFPP, the Central Valley Flood Protection Plan, builds on significant scientific and collaborative work over the past 15 years. It aligns with the Governor's Water Resiliency Portfolio Initiative and includes a commitment to protect and enhance natural systems. The conservation strategy, which is a major component of the Central Valley Flood Protection Plan, supports all of the CVFPP goals and focuses specifically on promoting ecosystem functions and initiatives. The Central Valley Flood Protection Plan is descriptive. It's not intended to be a funding or permitting decision for specific projects, but prioritizes the state's investment, as Marina highlighted a few minutes ago, in flood management over the next 3 decades. It promotes multi-benefit projects and also looks to integrate and improve ecosystem functions associated with flood risk reduction projects. Next slide, please. The regional flood management planning groups are our primary vehicle for local regional collaboration on flood management planning that rolls up and informs the CVFPP. They started prior to the 2017 update and have continued to play a vital role in our regional planning. The RFP region that supports Lake County is the Mid and Upper Sacramento River RFP, and they have already been incorporating projects in Lake County into the state system-wide investment approach portfolio update for 2022, which is the portfolio of potential management actions that can be implemented over time to help improve the systems in the Sacramento and obviously in the San Joaquin River basins. They've also provided opportunities, challenges, and priorities into what we're calling regional priorities white papers. Each region, each of the 6 RFPs have put together white papers that have helped guide some of the recommendations and some of the policy discussions in the plan. I understand that your county staff are or will be connecting directly with that regional group also. This is one of the most important ways Lake County can plug into the broader flood management planning within the region and with the state itself. Next slide, please. As the second update to the CVFPP, the 2022 update is updating the body of work that was produced in 2017 with new information and tools. The end result of this update will be an updated investment needs and recommendations to continue implementation of the state system-wide investment approach over the next 30 years. And while the broad strategies and concepts of the state system-wide investment approach have not changed since it was conceived as part of the 2012 plan, but in the context of this iterative planning process, refinements to that vision may be made as changes happen in the flood system, and then the complex variables such as climate change are better understood in our systems. Next slide, please. This is a brief layout of the working draft. So if you're familiar with the 2017 update, it was broken into 4 chapters. We're keeping a very similar layout in 2022, with chapter 1 being that context setting piece kind of sets the stage for how the SSIA, the State System-Wide Investment Approach, has been developed, a little bit of history behind the CVFPP, and then dives right into the themes that this draft will be focusing on, including innovation and adaptation to climate change, the effects of climate change, the accountability of our implementation actions towards an intended set of outcomes, so performance tracking, as well as collaboration with other local and state planning and implementation efforts to provide for more effective implementation of the CVFPP. Chapter 2 looks at what's been done. What's that implementation progress that's occurred over since the last update, since 2017, with regards to project implementations, partnerships that have been developed between local, state, and federal interested parties to help progress system-wide efforts, the policy issue discussion that started in 2017, an update on the progress of some of those recommendations, as well as some of the investigations and analysis that's been going on, including the technical and climate change analysis that's been undertaken, as well as the performance tracking work. Chapter 3 takes more of a forward look. What has to be updated? Still has to be updated. What are we planning to do? Kind of that big picture look at the risk priorities, the updated SSI portfolios. What are those outcomes we are trying to achieve with our planning and implementation in the system? So it gives us a broad look at those. And then chapter 4 will be that implementation chapter. How are we going to do this? What are some ways in which we can fund these efforts in a very tight money, funding situation? Additional in the public draft, what you'll see is there are going to be 2-page regional spotlights for the 6 regional flood management planning groups, 1 for each region. Those were developed in close collaboration between the regions themselves as well as the department. So you'll see those as it's kind of that regional space to provide their opportunities, challenges, and priorities. A really nice place. And then finally, we'll have what we're calling a call to action infographic. Won't necessarily be developed for the public draft, but it's something that will be developed between the board, Central Valley Flood Protection Board, and DWR with input as we move through the public process and get closer to adoption in the fall of 2022. That is when the department will produce and the Central Valley Flood Protection Board will adopt the final 2022 draft. Next slide, please. This slide shows the 8 policy issues. Well, there's 10 now, but the policy issues that are being discussed as impediments to implementation in the plan. In 2017, the 8 policy issues to the left, of the plus sign were brought forward as impediments, and recommendations were developed to help improve those policy issues and make implementation more effective. For 2022, we've added 2 policy issues, one surrounding the issues surrounding equity and flood management, as well as climate change adaptation challenges. And so we're taking a look at all 10 of those, and we're providing recommendations on how we can continue to improve each of those policy issues, which will help drive implementation and make it more effective. Next slide, please. So where we are, we put a working draft out in the fall for our interested parties. We got a lot of input from the regional flood management planning groups, as well as some other local municipalities. We are currently going through our final reviews of our public draft, including our DWR and Central Valley Flood Protection Board executive review, with the intent of releasing those documents here in the next month or so. We've also had ongoing consultations with various tribes in the region, as well as follow-ups with these county officials like we're having today, as well as meeting with the Sacramento District of the Corps of Engineers and what's called the Engineering with Nature group within the Corps of Engineers. The public draft will be fully formatted, ADA accessible, so it can be put up on the DWR website, and which is the main way we will be producing at least the public draft of the document. So you will see that it's come out in the next month or so. Next slide, please. This is the final slide I have. It's just our timeline slide. And so you'll see the top row is the line for the Central Valley Flood Protection Plan itself. You'll see that public draft coming out at the end of Q1, so that within the next month or so. And then that final adopted draft, as mentioned, will be prepared by the department and adopted by the board in late fall 2022. The other pieces are some of the components. The other rows are some of the component efforts, including the flood system status report and state plan of flood control descriptive documents. Those are coming out at a similar time frame to the public draft and adoption, as well as that conservation strategy, which the public draft came out in December, and we'll be looking to have all of those pieces come out in that fall time frame. The last row on the timeline, for the last row on the timeline, I will hand it over to Darren, and he'll describe the Central Valley Flood Protection Board public process.
Great, thank you, Jason. As Jason mentioned earlier, in accordance with state statute, the board will begin the process of adopting. In addition to the outreach efforts we've done thus far, we will continue a transparent process, which I appreciate, or I know this board appreciates, all of you in your elected capacities, having a transparent process for the public. To that end, our goal is to hold a public workshop in a public meeting on the Sacramento Basin, one in the San Joaquin Basin, and then one virtually. Of course, the public meetings will be based on or contingent upon COVID protocol with public in-person meetings. So we'll wait to know those aspects or requirements for sure. But then we'll continue to hold public workshops to engage on comments that we've received in the June or July timeframe. We'll also continue to accept comments at the regular public board meetings as well. And with that, I'll turn it back over to Jason. Yeah, that's the slide there that I was talking about.
Thank you, Darren. And I will add, before we go to, here's our contact information. Please feel free to contact us with any questions. I also want to add that we are intending to send out a large email kind of blast, I guess, to folks when we release the document, to give them links directly to the document. And that'll include members of the staff that we've been working with at Lake County, as well as any of the board members that would like a direct link sent to their document. And in addition, we will run a relatively limited amount of hard copies if there are folks that still enjoy feeling the paper between their fingers as they review things. So please let us know how we can provide those types of either the link or the hard copy to you. So now I guess we just like to leave some time for questions or thoughts.
Thank you. Supervisor Sabatier?
Thank you very much for this. Looking forward to the progress moving forward and completing over the course of the year. I was really happy to hear you speak of Middle Creek Restoration Project. I think that's definitely a large flood control project that we've been working on for, unfortunately, a couple of decades and hoping to keep moving forward and get that accomplished. Flooding occurs where there's bodies of water. The lake is a difficult one to tackle, with the water rights being in the hands of Yolo County and with the dam. But I'm curious about our what is being reviewed as far as our creeks. I know that, for example, it's been a while since we've seen some sort of dredging happening at the creek entry points into the lake, which can really hold back the amount of water that's flowing into the lake, which eventually then creates a barrier for that creek and then makes it more likely to flood down the creek further away from the lake when there's heavy amount of rains. Just wondering what is being reviewed for that, and I'll ask my second question after that. Just wondering how that review with the creek is going as far as looking downstream, what can be done at the entry point also at the lake.
So Marina, I'm not sure, I would say that one of the challenges I'm having with that question is, the creeks, there are going to be some creeks that are going to be more local jurisdiction and local challenges to deal with. And then there are going to be some areas where, if they're part of what are called the State Plan of Flood Control, that would be something that would fall more into the Central Valley Flood Protection Plan and working within this confines. So I will say it's a little bit of a challenge to respond. I apologize for that. But I will say, with regards to things that are within the SPFC, the State Plan of Flood Control, I apologize for the acronym, the alphabet soup there. those are things that we would work through the Regional Flood Management Planning Group, at least from a planning perspective. And then once it gets beyond the plan itself and gets into the process, then it's going to be working with some of our flood management implementation programs, whether it be some folks from the maintenance group, or if small communities, if it pertains to small communities. So it's without some of the detail, I guess that's probably the best answer I can provide at this point.
And I appreciate that, and I think the question comes from a level of ignorance on my part to not necessarily understanding the separation of what is covered by this versus what's not covered. But I do know that we have some problems in some of our creek entry points, and just wanted to see that. And then those that are and potentially will be covered by this plan, just to check in, because there's been a lot of conversation about the nutrient overload coming in from the creeks into the lake. Is there any potential overlap of dealing with slowing down the creeks in order for the nutrients to drop before going into the lake, or is that not at all something that can overlap with this program? Sorry if the questions are from left field.
No, it's a good question, and I would say that things that we are looking at just from an overall planning standpoint are those multi-benefit type efforts, in which you're talking about the balancing of the flood management challenges that occur in a creek, but also the in this case the water supply type challenges that come from an overload of nutrients into a water supply source. And so I would say, just from a generalized standpoint, that is something that as we're working with the locals, in this case, as I mentioned, we deal mainly with the regional flood management planning groups, that would be something that they would propose potentially as a multi-benefit type project. And then we would look at it, as I mentioned previously, that the plan itself wouldn't say, okay, project X is what we want to move forward.
Right.
But as that project comes higher in the priority list and becomes an item or a management action that the whole, the locals and the state want to move forward, then it moves into those program areas. I know I'm not really giving you a great answer on that, but it does kind of, it's a little bit of a challenge to respond, so.
I appreciate that.
If I could add, maybe, oh, sorry.
No, go for it.
I was just going to add, maybe what we can do is have Jason and his team follow up with Marina after this meeting to get some more details about where some of these creeks are, or where some of these water quality nutrient issues are, and see whether they would fall within the scope of the CVFPP, or in the case of the water quality, whether issue it might be more appropriate to follow up with the State Water Resources Control Board or other avenues to try to find a solution, funding or a project or something like that.
That's great.
I appreciate that, and I also appreciate, Mr. Seidley, your response saying that multiple purposes, multiple functions of the work that could potentially be done is definitely something that will be looked into during this process, and I appreciate that, because I think that fits and answers the question that I asked. My last statement is, it's both great and awkward to talk about flooding at a moment like this. I'm glad that we're discussing it prior to it happening. We should always be moving forward on protecting our communities, but it would be nice to at least be a little closer to the potential of flooding versus where we are currently.
Oh, shit. It's definitely tough to talk about when it's 75 degrees on March 1st. So.
But thank you very much for this presentation.
You're welcome. Thank you.
Yes, and go ahead, Marina.
Thank you. And if I could just add one more thing before we close out, I want to thank the state for taking the time and coming to this discussion and sharing with the community how they can get involved with this update, and just want to reassure folks we will continue with this dialogue. And then here at Water Resources at the local level, we will make sure that we have this presentation on our website, and we will also have the links to all the updates and the documents as related to the CVFPP. So thank you so much to the Board of Supervisors for allowing us to talk to you today, and thank you so much to the state for bringing us in this very important conversation.
Thank you.
Thank you.
Yes, and I thank Supervisor Sabatier for mentioning the Middle Creek area. I'm also, there's been a lot of interesting discussion in my town hall for West Region Town Hall, and they've been really concerned with the channel of Middle Creek, the historical channel. And so they've been, talking about that quite frequently. And I know that there's work being done, and there's been presentations that have been conducted and whatnot. However, it's just been a very interesting, well, not just interesting, but it's been discussed quite frequently in that town hall. And so this presentation helps. I hope some of the constituents from Upper Lake have tuned in. Yeah, just wanted to add that. Are there any, I didn't open it for public input, did I? And we have Vice Chair Scott.
Just wanted to add, I have the Scotts Valley Community Council that actually came together because of the flooding in our area. And, we're really hoping that we can dig into our creek beds, literally, and be able to remove some of the sediment and the gravel. And we have a community really working hard to try to make sure that we're doing the best that we can for making sure our roads are clear, buses can get through, and that houses don't get flooded. And so this is a really important topic to keep up on. Thank you.
Okay. Let's see. Is there anybody in the chambers that would like to talk about this discussion? Okay, we'll look online and see if we have anybody in. I don't have anyone in Zoom. I don't see any hands raised, so we'll bring it back to the board. Let's see what we have here. It's a presentation, so thank you for the presentation. Sorry, I wanted to make sure. I didn't want to gloss over it, and then we had some sort of vote. Thank you for your presentation, and have a good rest of the day. Let's see what we got here.
Thank you, Chair Crandall, and thank you, Board.
Right. We will go back to, let's see, go up to, you said, Supervisor Sabatier, there was another situation on a consent agenda that you wanted to discuss or something of that nature, so.
Yes, I apologize. I'm wondering if we can walk backwards our approval of the consent agenda and pull out item, I wanted to correct item 5.6.
5.6, okay. So with that, we would need to,
Which one?
I'd like to make a motion to reopen the consent agenda.
Second?
I think Ms. Grant stated we just need to reopen 5.6, is that, or do we need to open the whole consent agenda?
You're going to have to reopen the entire consent
Okay.
agenda and then pull
Got it.
5.6 for reconsideration.
So we will, so we have a motion to reopen, and
A second?
we have a second by Vice Chair Scott. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
And so,
Mr. Chair, I'd like to approve the consent agenda, items 5.2, 5.4, 5.5, and 5.7 through 5.13.
Second.
I have a motion and a second. I'll open it up for public input in case there's any other public input for this, and I'm not seeing any on Zoom or in the chambers. With that, we have a motion and a second, so Johanna, please conduct the roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
So we will, let's see, we'll go straight to 5.1. Or would you like to go straight to 5.6? I'm fine either way.
For 5.1, if you want to take that up now, we were going to invite Patrick Sullivan into the discussion, and Director Darby may want to participate. Supervisor Sabatier, did you have anyone else in mind?
That would be perfect.
That's okay. So 5.6 was voted on to be pulled.
Yes.
Okay.
Yes.
Okay, just
For
wanted to make
discussion.
sure.
Yeah. So Director Darby is in as an attendee, and I gave her an invitation to join us in here if she wishes.
Okay, so while we're waiting for her, I'll go ahead and read 5.1. Item 5.1 of the consent agenda is a waive the formal bidding process pursuant to Lake County Code 38.1 as an extension of an annual agreement, and approve agreement of provision of satellite imagery services by Planet Labs for the County of Lake. And
So would you like Patrick to present this, Supervisor Sabatier, or did you just want to comment on it?
I can comment on it. I don't know what the board prefers, looking at you, Mr. Chair.
yes, go ahead, comment.
So I had two things that I wanted to bring to the board for discussion today, rather than postponing it and then providing my input on it, just in case. Number one, I feel uncomfortable with the waiving of the bidding. There are definitely multiple companies. I think when we first started this, it was very limited in scope. And I also, from reading other agencies using Prop 64 funds, it's not by state virtue that we have to use Planet Labs. Maybe we wrote Planet Labs in our grant application, and I'd like to find out if it's possible to that the state would be willing to let us change that. I know there's been some issues, not huge issues. I know it's been very slow at times to receive the information from Planet. I know that sometimes the information is difficult to perceive whether you're looking at a tree or a house, or it's not always very clear as to what you're looking at. Depending on what the picture is that you're looking at, cloud cover can definitely make a difference as well. And when I did some Google search, there's at least 5 or 6 companies that I was able to find that use satellite imagery, some of them with some greater level of detail. I don't know if that means greater amount of cost, but I think that a bid, I almost wonder, what is the purpose of the satellite imagery? And that purpose can be put into an RFP that would then help us make sure that we're reviewing the different products to fit our purpose. Because one of the things I wanted to bring up as well is, I think the majority of the use of this has been for our taxes. It has not necessarily been used for illegal cannabis. I don't believe any illegal cannabis has been eradicated by using this software. It has not been utilized, I don't believe, by our building and inspection, where we can see that there's new buildings that are unpermitted that then we can go after and make sure that they do the appropriate process. It has not been shared with our sheriff. I checked with our sheriff, and I think that from the contract that I've read with Planet, it's available to the entire county. It's not just available to community development or for cannabis. It can be utilized for the entirety of, this is what we see, how can we utilize this? I think our assessor might be able to use that as well to help them out. So I think there's a lot of things that are available and that we're not using it for. I know we spent $50,000 last year, and I don't believe we actually received the total $50,000 worth of value in return. And my last thing is, I'd like to know what our plan is, because in the memo, it says something about illegal cannabis, but again, I don't think we did anything, if not much, for illegal cannabis using this Planet satellite imagery. I'd like to know what a policy or what our plan is to really go and use this for illegal cannabis and make it as public as possible. This is what we're doing. We're coming after those who are not following the rules. That way it helps to hold us accountable for making sure that we do the things that we want to get done, or else we're going to have another year go by potentially where we can't, there's nothing to hold us accountable for that. And granted, it's staffing issues and other issues that come along, but I think that it helps when we have a plan, rather than saying, oops, we weren't able to make this happen. And I know there was a lot of transition and a lot of issues that came along to not make things happen last year, but I want to make sure that things happen this year. It's important to me personally that we use this software for the greatest purpose that we can. And because of what happened last year, I'm somewhat concerned to waive the bidding and just say yes without knowing what exactly are we planning to do.
All right, so either Director Darby or Patrick, if you'd like to add anything to or answer any of the questions, or we'll give you the opportunity to go ahead and state to us what that is.
Sure. Well, if it's all right, I can lead off with a little bit of background on the program and why we wanted to go down this path. As Supervisor Spatier did point out, this is part of the Prop 64 Public Health and Safety Grant. And this was included in our proposals, and it's been mentioned and referenced in all of our meetings with the state since the grant began. I think there were supposed to be a few points that went along with this grant. There was supposed to be a dedicated cannabis code enforcement officer that was going to be using this satellite imagery as we went through it. An officer was hired last year and was unfortunately only here for a few months before he moved on. So I believe that was a major hurdle to getting a lot out of this imagery. We did get a countywide image done. We did get various hotspot imaging done, but I believe Supervisor Spatier's point is probably correct that there wasn't a lot of other enforcement related to this imagery through code enforcement during this period. The tax program has used it considerably. We have made it clear to other departments that have wanted it that they could use it. We haven't had a lot of interest. We had reached out to the sheriff's office, but I don't believe anyone has actually requested access to that data. But it is available. Other county units can use it. Our license allows any county employee to operate with that. We did go through multiple trainings with Planet. Unfortunately, most of the staff that was trained during the various periods is no longer with us. So that has also been a hurdle as we've gone through this. So I think from staff's perspective on trying to stick with Planet is that we have worked through a lot of the technical difficulties. We've been having regular meetings with them. We have the hosted data connection up and running where the more refined imagery is available. They're working on a lot of the corrections and additions that we've asked for, at least from a technical standpoint. So this is the product we've been working with. We're in the middle, we're about halfway through this grant. And we're hoping to try to get the ball rolling here because this is our second to last season where we have this funding available, where we can show that we're making a difference. And that would be starting next month, or April, May. So I think the concern is that we've put a lot of effort into trying to get this Planet agreement right. And there is still not a cannabis code enforcement officer in CDD that's assigned to this grant program. So I'm just not sure what capacity they have to be able to dive further into this. So I'd probably defer to Director Darby on that aspect.
Hello, everyone. How are you doing?
Hello,
good morning.
Dr. Darby.
Sorry, my computer, I couldn't get it to unmute, so I missed some of the questions, but I've been following the conversation for the last few minutes, so I'm kind of sure where we are. So in terms of the satellite imagery and a code enforcement officer, we are advertising now for a code enforcement officer for cannabis specifically. However, the satellite imagery is being somewhat used now by our code enforcement manager, and we are training the new code enforcement 2 roadmap task force officers that we have on board that's joined us in the last month to use it. So I think that in the near future, we'll be able to utilize it better. I do understand the concerns about the clarity of the satellite imagery, but I would like to have a little bit more time to kind of visit that to see how that's working for our team. And I think that will take approximately another couple of months for us to see how the satellite imagery is working for the CDD team. So we do have players or the capacity to use it as of now.
Thank you.
Is there another question that was mentioned that I didn't answer?
I would say that the one big part for me is I feel like last year's return on our investment was absent in comparison to what was expected. And I'd like to ask, and granted it would be through the board, not me, but my personal opinion, I want to know what our plan is. How are we going to utilize that satellite imagery to go after the things that we are able to catch through the satellite imagery? Because if all we're using it for, and I know that's not all we're using it for, but the majority of the use last year was for taxes, we could have waited an extra 6 months and through Google Earth get the same type of information for free. And it just wouldn't be as quick. But I'd like to know what the plan is, and if it's possible to maybe come back and publicly provide a plan to the Board of Supervisors. And again, that has to come from the board, not me. That's just me and my opinion.
If there's a need for me to present before the board about the satellite imagery and our proposal on how we would use it, it would be used not only by code enforcement, but also by our planners as we go through each individual application for projects that we receive, whether or not it's a use permit, other types of application that requires review. It would be very beneficial to be used in that sense as well. In addition, it would be a beneficial use for our building officials as they go out and they're dealing with grading issues or tree issues. I can see it being used there as well, but I would like to have the opportunity to come back and present to you a strategy or a plan in which it will be used specifically.
That puts a smile on my face. But again, it doesn't need to come from me. It needs to come from the board. So I don't know how the rest of the board feels.
Supervisor Pyska?
Sure. I have a question, Patrick. How many images are we going to get this year? Is it one image? I know last year there was a long processing period. So what's the plan with the image, and then what is the time lag before it's usable?
So a lot of that I would hope could be worked out specifically with code enforcement when it gets going, but there's two parts to this. We have enough within this contract to get a countywide image completed. But then there's also remaining funds that can be used for more specific targeting of different areas. So if code enforcement wanted to follow up on certain neighborhoods, certain regions, there should be plenty of funding left to do that. We can always add increments to this contract if we needed to, but the highlight of it, and part of the reason that we picked this lower amount last year and the lower amount this year, is we have a large pot of funding left under this grant that's going to expire at the end of 2023, I believe. And once you sign an agreement for satellite imagery, it's basically use it or lose it. So our concern was we didn't want to potentially sign up to purchase more if we weren't sure that it could all be utilized, because that is the problem that we ran into last year, and we want to ensure we don't end up there again. But the main focus is that countywide image. There's funding available for more imagery in spring and fall, both for planting and harvest time, if code enforcement wanted to look at it. Again, anyone that works for the county would be eligible to look at this, but in terms of the actual targeting of the imagery to be in compliance with the grant, it does have to be specifically targeted for illegal cultivation.
And how long does it take to process the image?
It depends on what Planet's constraints are at the time. Because so many other agencies are using this for cannabis cultivation in our area, we found that July, August, for instance, is very busy. So if we want an image done during that time, let's say of the whole county, we would want to notify Planet probably by early June that we want that image done. When it's less busy, for instance, April, May, earlier in June, in our experience, often the image is back within several days to a week of when we've ordered it. So it depends on both the size and scope of the image and how many requests Planet has at that moment.
Thanks.
Supervisor Sabatier?
And that's part of the strategy that I was kind of talking about, is what are our dates that we're looking at in advance? That way we're very proactive about how we're planning to use this rather than reactive. And I think it helps out.
And I think too, it gives the constituents a chance to know the strategy plan that we're going for, because as of now, I know we have our town halls where they come and explain it, but at the same time, at the board level, they know what's moving forward and how we're using that to fight what they commonly are upset about. Vice Chair Scott.
You know, I definitely agree. This is a very important piece of technology if used correctly. So if we could lay out a plan of how we're going to use this, how we're going to tackle it, I think that would be important. I know the question was raised if waiving the formal bidding process was appropriate. And with any technology, I think it's appropriate, as Patrick pointed out, that they're just trying to get to understand these programs, and I think it would be detrimental if we went in and used a different server or different product, and then we would be back at square one trying to learn how to use it. So I think it's very important to stay with what we have.
Supervisor Sabatier?
And I can agree to move forward with the waiving of the bidding due to the fact that it's part of a grant and seeing this as more of an amendment rather than a brand new contract. But what I would suggest is that we definitely look to see what other software is out there, because some of the software that I identified when doing my research use artificial intelligence to help us find the things that are different on the map. Because if you have a year-to-year or month-to-month, the artificial intelligence could automatically find out, hey, these things have changed, take a look at these areas, and then it can highlight new buildings that were built without permits. It can highlight cannabis grows that we weren't aware of. And so I think that there's other things that, I don't know if it's available already with Planet and we're just not utilizing it, but it seemed to me like there was other tool sets within the programs that were offered from varying different people. So I'm okay with the following what we have, for the fact that we do want to move forward and make sure that the grant gets spent appropriately for this. But I think that there's definitely good reason to look around after the fact.
All right. Go ahead, Patrick.
I can just add one other point regarding what Supervisor Sabatier brought up. There may be the opportunity for even further funding under this current grant agreement later this year if other options were looked at, because we are having large cost savings under salaries and benefits. That was part of this grant program. And we can petition the state, if we can sort of show success moving forward with this program, to reallocate those funds to another part of the grant, like satellite imagery.
Thank you.
Thank you, Pat.
So, Mr. Chair, as we said earlier, we're not able to approve this agreement today because there's still a minor issue being worked on, and so we would have it on the agenda next week for approval, and then when everyone is ready, the plan.
All right. So I'll open it up for public input. It looks like we have somebody in the room that would like to speak. If you can come to the microphone, state your name, and you have 3 minutes.
I have not studied it. I'm Joan Moss. I'm an interested person, journalist, etc. I want to point out that Ms. Darby mentioned a lot of other uses for this satellite imagery. And what I want to know is this for illegal cannabis, or is it for other building issues that Ms. Darby has on her table? And is this Big Brother watching us without our permission? No. I just want to know that. I mean, anybody can use a satellite to find out anything. Is that true? Thank you.
Thank you. I think she stated that earlier when we were discussing it, that it was for building or cannabis, but we needed the training on it. There was someone hired for it. And I'll let Ms. Darby answer, but I don't think it's for Big Brother. We're not involved with that, but I'll go ahead and let Ms. Darby answer that.
Ms. Moss, how are you doing today? So it is not for Big Brother watching. The question I received was there other things that we could use the satellite imagery for? And I mentioned that we could use it for when we're going through our zoning applications to see whether or not there are illegal items on a particular lot. But I think I heard, just for clarification purposes through Patrick, that Patrick stated that it was purchased for cannabis. Is that correct, Patrick? So I could be incorrect with other uses that I was proposing.
I think the key aspect is because the state is paying for it through this grant, the core primary purpose has to be for targeting unlawful cannabis cultivation. But once we've acquired that imagery, any county employee is allowed to access it and they can use it for whatever purpose they like. just the targeting of it, the primary purpose has to be for unlawful cultivation.
Thank you very much for that clarification. In that case, I would propose that we would use it for our zoning applications as well as it relates to trees on a property, or just to see behind a fence. Sometimes when code enforcement goes out to sites, they can't see behind fencing. So that would be one of the other tools that we can use the satellite for.
Thank you for the responses. Supervisor Sabatier?
And if I may, I wish there was a better term than Big Brother, but it's a more recent version of what we all look at when we look at Google Maps and Google Earth, except that I think that the important part is look around and what's happening in our county on Google Earth and start changing the timeline and see that people are absolutely devastating our environment, and we're not necessarily aware of it until we start utilizing this type of technology, and we need to be cognizant of it happening as quickly as possible rather than finding out 10, 20 years later that there's been an environmental crisis occurring in a specific area. And so I think that this is a really important tool to have. I don't see it as Big Brother, but it is a camera system. We can't see license plates. We can't see check numbers. We can't see we talked about the clarity of it. It makes it difficult already to kind of decide what it is that we're looking at certain times. But just like Google Earth, you can recognize the majority of it. It's when you're looking for something very specific that at times it can be a little blurry.
All right. So I'm looking in the Zoom room. I don't see any hands up there. Nope. So we'll bring it back to the board. And so it sounds like we're going to move this to next week as well?
Yes, it will be on the consent agenda next week for approval.
Okay. Thank you very much, Patrick. And
I have one more question.
Sorry.
No
Supervisor
problem.
Paisy, go ahead.
When you're scheduling with Planet, is there any leeway to kind of change the date last minute? I'm just concerned if we're planning on doing this in July or August and we're having smoke. Is there a way to kind of adjust the dates on the fly if we have to?
Supervisor Pyska, yes, they do have the ability to change dates as they go. Part of their programming also will identify if there is too much cloud or smoke cover, and they'll keep trying to redo the image until they get one that has less smoke or cloud cover. So they guarantee a certain degree of clarity. And I have talked to them before about an image where we were dissatisfied with it, and they didn't have any problem redoing it. It should not count against our use quota if we need to redo it or change a date due to wildfire, let's say.
Okay, thank you.
All right. Thank you.
Oh, I'm sorry, this is Director Darby. For clarification purposes, so if it's going to be on the consent agenda on March the 8th, that would mean that you would want the plan of action from CDD prior to that on how we would actually use the strategy to use the...
No, what are you looking towards that timeline?
I'm not going to give a specific timeline. I'm going to let Director Darby make that decision based on her staff and her capacity. But I would love to have that come back to us for a presentation so that the board is aware of what the plan is and the public is made aware of what the plan is. And those growing illegally could be made aware of what the plan is so that they can be a little bit nervous of doing these things around here in Lake County.
Okay, thank you for the clarification.
Thank you for the question. All right, so it looks like we will finish that item and look for it on the agenda next week. I know so we'll move on. I know 5.3 was pulled till next week as well, right?
5.3 is pulled indefinitely. Okay. We'll just see what it needs in the future.
Okay. And with that, we will move on to 5.4. Is that the one you pulled?
5.6.
5.6, sorry. 5.6. Approve amendment to the agreement between the County of Lake and Vista Pacifica Enterprises Incorporated for adult residential support services and specialty mental health services for fiscal year 2021-2022 to decrease the total compensation payable under the agreement by $8,000 for new contract maximum of $52,000, and authorize the board chair to sign. And it looks like that would be Director Metcalf, if you are on. I think this is your item. Supervisor Sabatier, go ahead.
And I just want to simplify the process. There's nothing wrong, in my opinion, with the contract or the amendment. It was simply a numbers issue where on the memo and on our recommended action, it said payable under the agreement by $8,000 for a new contract maximum of $52,000. The original contract was $110,000. It's a reduction of $58,000. Within the actual amendment agreement, it says it correctly, but in our recommended action, because it was incorrect, I wanted to make sure and pull that and fix that. It should be $58,000 to make a new contract maximum of $52,000.
All right. Director Metcalf, I see you're on, so I just want to go ahead and give you a chance to state anything if you need to.
Yeah, Supervisor Sabatier and I already had a conversation about it. It's just we're just off by $50,000, and so he articulated it perfectly well. So yeah, the contract is correct, but the memo was incorrect. So we just wanted some clarification, or provide clarification.
Okay, thank you for that. So we'll go ahead and open it up for public input. There's nobody in the room I see that's jumping up, and I don't see anyone in the Zoom room. So bring it back to the board for action.
Mr. Chair, I move to approve the agreement between the county of, or the amended agreement between the County of Lake and Vista Pacifica Enterprises for adult residential support services and specialty mental health services for fiscal year 21-22 to decrease the total compensation payable under the agreement by $58,000 for a new contract maximum of $52,000 and authorize the board chair to sign.
Second.
So I have a motion and a second. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier.
Aye.
Supervisor Scott.
Aye.
Supervisor Pyska.
Yes.
And Supervisor Crandall.
Aye.
Thank you.
All right. CAO Hutchinson, is there a preference? I know we have, it'd probably be a good idea to talk about the possibility of lunch. I see we have quite a bit on the non-timed items, and so I know some of those might be lengthy. Is there one that anybody out of the directors would like to probably go now, or has time limitations or anything like that?
We have the Health Services Director and the Sheriff in the Zoom, and I imagine they're here for the local health emergency and local emergency declarations, the renewals, and so I might request, I think that discussion, all of those items will go relatively quickly. We're talking about 7.7 through 7.13. So I would ask if you might consider taking those up now.
Yeah, I think we'll do that. That's a good idea. So we'll start with 7.7. Consideration of continuation of local health emergency by the Lake County Health Officer for the Cache Fire. And so...
And let's see, so we're seeing the Sheriff now, and we're seeing our Environmental Health Director. Director Portney, are you still with us? I saw him a moment ago.
Yes, there he is.
There he is, okay. So, so yes, we'll start with the Cache Fire.
All right.
And Mr. Chair, I did put at your workstation a summary chart that tells you where we're at with each one of these. And you'll note on that summary sheet that there are two we are not renewing, so you do not see them on your agenda for Mindo Complex or Pawnee. Those will be phased out. And so then we'll yield to the respective departments to tell you about 7.7 and so on.
All right. Director Portney, we'll go ahead and give the floor to you.
Great, thank you, Supervisors, and again, thank you for your time. Sheriff Brian Martin and our Director of Environmental Health, Greg, are with us today, and they are well versed on the matter, and they will take it from here.
Okay. Sheriff Martin, if you wanted to go ahead and elaborate.
I'll certainly defer to the Environmental Health Director. I think a lot of this circles around the environmental impacts of the cache fires as it impacts the city of Clear Lake.
I just knew that Craig Weatherby batted third in baseball, so I wanted to make sure he was in that same position. Go ahead.
Your memory is faulty. I batted cleanup. Thank you very much. Thank you for this morning for the opportunity to talk a little bit about the Cache Creek fire. I am happy to report that the work has been continuing and ongoing. The state has completed many of the cleanups for the properties. However, they are continuing work at this time. They are out there this week, working on several properties for erosion control. And I believe they also had a couple of properties where they needed to do rescrapes as they came back high in either lead or mercury or something along those lines. So they are conducting those cleanups now. This cleanup is being administered by City of Clear Lake. So we are working with City of Clear Lake, Mr. Flora, that we've been working with directly on that. So they need a little bit more time to complete this. I recommend keeping this emergency declaration open at this time.
Thank you, Mr. Weatherby. Do we have anything from the board? Supervisor Sabatier.
I know from the last report from the City of Clear Lake, I believe they had some issues with 3 properties for right of entry, and so that's definitely something that's keeping this open because of that. And so appreciate that they're coming back, though, to rescrape and to make sure that it's done correctly. So thank you for the update.
All right. So I'll open it up to the public. Is there anybody in the chambers that would like to talk about this item? Not seeing any. I don't see any on the Zoom room with their hands up. So I'll bring it back to the board for deliberation.
Actually, I do have one question. Mr. Weatherby, I know that this emergency declaration was done because of the debris, but there are still some homes that are not connected to a water source at this moment in time, especially the ones in the Cache Creek RV Park, and just curious if that lack of connection will continue our local health emergency, or is it solely based on the debris process?
That is an excellent question. Thank you for asking. My focus has solely been on the debris removal. I have not commented to the water source. I know that water sources were connected to a couple of the parks from county services that used to be on private service. So they do now have emergency connection. I'm not familiar with the remaining of the projects, and it might be worth looking into their water status before we close out the Cache Creek emergency proclamation.
Thank you.
Thank you. Okay. I think we're just looking for action.
And if nothing further, Mr. Chair, I move to approve the continuation of local health emergency by the Lake County Health Officer for the Cache Fire.
Okay.
So I have a motion and a second. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Yes. Thank you very much, Director Portney, Sheriff Martin, and Mr. Weatherby for your assistance on this topic. All right, we'll move on to 7.8, consideration of continuation of a local health emergency related to the 2019 coronavirus COVID-19 as proclaimed by the Lake County Public Health Officer. And with that, we will continue with, I think it's Director Portney. Yeah, go ahead, Director Portney.
Hello. Thank you, Supervisors, for your time again. So the request in the amendment is to, if I'm understanding correctly, lift the state of emergency for COVID-19.
No, I think it's to, which is declared, Mark. I think it's just to continue, if we're going to continue or lift, yeah.
My recommendation would be to continue while still following the CDC and public health guidelines. We are considering, based on the slides and feedback we got this morning, around our current position in our red tier. I think and would advise that we continue moving forward for the safety and betterment of our community.
All right, thank you for that, Supervisor Sabatier.
So I did have a question. I guess this might be a question for any of the 3 that I see on the screen right now, CAO Hutchinson, Sheriff Martin, or Director Portney. There's 2 current emergencies related to COVID. There's one from the sheriff and one from public health. Does one or both need to remain open in order for us to continue the processing of reimbursements? Because I know that's one of the things that Cal OES, even though the emergency may be over 5 months, 6 months ago, that we continue some of these. Does it matter which one it is? Just kind of curious.
So I'll wager a response unless you want to, Brian. Do you?
Your response might be similar to mine, so I'll let you go.
Okay. So with the local health emergency, which is what we're discussing right now, keeping that open enables the public health officer to have powers to make orders related to that. There are presently none in place. We're operating under the state order. So that's about as far as I can go in answering your question, Supervisor, although Anita may have more to say on that. The other emergency, which was decreed by Brian as our OES director, is the one that definitely is linked to being able to continue to claim state and federal funding. And so that one needs to remain in place. I don't know much more to say about the local health officer one.
Yeah, if I could add comments to that. So that will be important to leave it open, and this is why. We aren't out of the woods yet, and our hospital infrastructure and our infrastructure in general, whether it be jails, schools, hospitals, we still need to track this stuff, utilizing our epidemiologists and case rate within community. And now, as Dr. Pace indicated, these spikes come in waves, right? And so we do not want to close this order with, God forbid, in the next 3 months, we're in a more dire strait, not allowing the health officer the opportunity to put necessary processes in place to protect communities. So my recommendation would be to leave it open.
Ms. Rand, did you have anything?
I would just suggest that it is the health officer's determination that's before your board today in terms of the continuation. And your board may very well want to consider getting further information from a medical professional on a new agenda item before you determine to simply dismiss this out of hand.
Thank you. Thank you. All right, Supervisor Sabatier.
And just as my curiosity, again, looking for board consensus if this is something we can do. If it's possible, when we redo this 30 days later, I know there was a question from the public, and I think it was a good question, and I am curious to know what the answer is. I have an idea of what it is, but how much have we spent for vaccination, for testing? I know that we've received a lot of grants. I know that we've spent a lot of that money from the grants, and I'd love to get a little bit of a report to see exactly how much money have we received and how much money have we spent towards the purpose of protecting our community and providing those services. I think that would be a good piece of information, but again, looking for consensus from the board. And also, I missed this during our previous COVID conversation, and I think it's still relevant to this subject here, which is we also had a contract that we signed with both Kanokati Wellness, I believe is the name, and also Lake County Office of Education to really push and focus messaging and support for our tribal and Latino communities. It would be nice to also get a little bit of feedback on how that's done, because seeing the numbers that was provided just earlier, granted it was only for the month of February, it wasn't for a very long-term look, shows me that while it may have had good intentions and may have had some efforts made, that it didn't really show up in numbers. And so I would be very curious to understand exactly what has been done and what has been attempted, because I think that there's learning moments from those things, and I'd love to better understand how those funds were utilized and what was the return on those funds.
Leo Hutchinson.
And so, Mr. Chair, the next date that these renewals would land on your calendar again, since they have to be renewed every 30 days, or they disappear if you don't, that would be the 22nd of March. And that would certainly give Dr. McLaughlin an opportunity to get his feet on the ground and perhaps have a recommendation to associate with what this happens next with this particular one. In terms of the department's ability to provide the financial information requested, it's possible, I'm looking at JP, but it's possible we may need more time. His department is in transition as they build the finance side of the house, and we would also likely need to confer with the Auditor Controller's Disaster Finance Office. And so, JP, I don't know what your thoughts are on that, but I'm not sure we can do that immediately.
Yeah, I find great value and Supervisor's comment regarding an update of what it looks like with the idea of hopefully coming out of COVID and our successes. I would like to bring that report to the board, and we do and are actively on. We have just hired a finance lead, and we do plan on putting together a portfolio of our current state financially in regard to COVID and expenditures, and we will do our due diligence in getting that to you. We would need to continue to onboard Dr. Eric, which will let's see, if we could have a solid month realistically to finish the onboarding, get our finance onboarded, and shift through the finances, we can pull some information together to be able to present. And from there, if any additional information is needed, we will take that and come back with more specific asks.
Thank you for that. I think that's amenable. I think see people agreeing to that.
Just to clarify, this renewal can't wait a full month. We would have to have that on the 22nd agenda. We can just put it on consent if your board wishes, based on what Director Portney is saying, and then he can come back with the broader discussion sometime thereafter to give him his month.
We'll still pass it, but just knowing that we're having that, I think is a good thing. Thank you very much for that. I opened public input for this. No. Okay, I did. Okay, I have public input. If you have something you'd like to bring, question, come forward, and you have 3 minutes.
Joan Moss, I want to know what it means to be in the red tier. Thank you.
Mr. Chair, we haven't discussed a red tier today. It's not part of this this agenda item. The red tier was part of the state standards, which were discontinued a number of months ago.
I think it was the CDC.
Yeah, I think it's the
It's on the CDC website.
Yeah, so there is a red tier, and I think it's relevant to this topic since it's a local public health emergency. Wondering if Director Portney might be up. Is he frozen or?
Oh, he's there.
I'm here.
Okay, there. He was very still.
So if I'm hearing the question correctly, what does it mean to be in the red tier? So there is a green, yellow, and red tier. And if we wanted to use traffic signals, right, in relation to COVID, green is you're good to go with lifting most mask mandates and life is normal. Yellow is you better be cautious because you're not out of the woods yet. And red is there's a real cause for concern, and you might want to ensure that appropriate health measures and preventions are in place to preserve life, reducing sickness and death. So to get really specific, Lake County is in a red tier because our data shows that our cases and our rates in the county are higher than counties that may be in the yellow or green tier. And because we are in the red tier, according to the CDC's website and metrics. According to our data with hospitalizations, case and rates, we have to be cautious and stay diligent. So that's what I mean by the red tier. And that is the tier that Lake County is currently in regarding COVID-19.
All right, thank you for that. Appreciate that explanation. We'll go ahead and open it up to the Zoom callers. Julia Bono, you have your hand raised. Please unmute, and you have 3 minutes.
Hello, yes, I previously spoke before the board on the subject of mask requirements and mask mandates. I am firmly against the use of, I have degrees in scientific research. I'm here to speak against the use of mask mandates to prevent the transmission of the SARS-CoV-2 virus that causes the COVID-19 disease. There's hundreds of peer-reviewed studies that show surgical ear loop masks are generally ineffective against preventing the transmission of tiny virons, including those on the order.
Is it possible to interrupt, because there is no current mandate coming from public health officers, and this local emergency only allows for the public health officer to be able to I guess you could speak against it happening, but the only mask mandate we have is for our public buildings that are done by the Board of Supervisors, not by the public health officer at this moment in time. Just wanted to at least direct you on your argument that you're making.
Thank you, sir. So are you saying that I need to address, I really want to address the ineffectiveness of mask mandates and inform anyone
We're talking about the ongoing health emergency.
So mask mandates or using masks to combat this would not be relevant?
But there's no mask mandate except for in public, except for in county buildings. So, it's not necessarily mandated. It's just an order that we gave so that we protect the employees and the citizens that are coming in. So there's not. So I don't know what you're talking about, a mandate like in the county or something of that. That's not on subject with the emergency per se.
I see. Well, in that case, I'll just simply put into the conversation the hundreds of peer-reviewed studies about the ineffectiveness of mask wearing. So if the county or any of its advisors or actors decide that masks are an appropriate response, I wish to counter that with the hundreds of peer-reviewed studies that I have discovered saying that they are not effective against microscopic virons like the SARS-CoV-2 virus. That's mainly what I wanted to add to the conversation.
Thank you. Thank you. So I'm not seeing any other hands raised on the attendee list, so I'll go ahead and close public input, and we'll move forward on this, see if we can move forward with action.
And I apologize for that interruption to the commenter, but I think that it directed her in the right appropriate statement of saying if something happens that she would disagree with that. So convoluted the conversation.
You helped because I stopped people before, and I don't want to stop people. Sometimes I get confused about what I can stop for or not. So apologize for that.
And if there's nothing further, Mr. Chair, I move to approve the continuation of a local health emergency related to the 2019 coronavirus COVID-19 as proclaimed by the Lake County Public Health Officer.
Second.
I have a motion and a second. Johanna, please conduct the roll call.
Okay. So Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
Right, 7.9, consideration of continuation of local health emergency and order prohibiting the endangerment of the community through the unsafe removal, transport, and disposal of fire debris for the LNU complex wildfire. And this Supervisor Slot, well, it says actually Dr. Pace, I'm sorry. I'm looking at the 2 and it says something else, so. Well, who?
This one would be Director Portney and Environmental Health Director Weatherby.
Thank you, Supervisors. Good to be with you. I'm going to pass this to the expert, Director Craig.
I'm back. LNU Lightning Fire Complex is a little bit more complex than Cache Creek. 90% of the work has been completed and properties have been returned back to the property owners. work was amazingly well done by the state, and we appreciate their assistance. We do have one remaining property that's actually over 2 contiguous properties that is still pending private cleanup. That particular process has been made difficult by ongoing litigation with the state. So it is remaining uncleaned at this time. And that's why we are keeping the LNU open so that that debris, when they can get done with their litigation, can get to the landfill and they can complete their cleanup process.
Thank you, Director Weatherby. Supervisor Sabatier?
Yeah, I was just curious, have any mitigations been done to help ensure that the debris that is left over on that property does not extend further than those properties after rain and other kind of elements?
There were initial, the program was, or this particular property was initially put into the program for cleanup. However, due to the nature of what happened, and I'm not at liberty to discuss the specifics of the property, this debris basically made it through 2 winters, and much of the debris may have washed down into the creeks and so forth, exactly what we did not want to have happen with these properties. But again, the ongoing litigation with the state, we are in a holding pattern until they can get that dealt with.
Thank you.
All right. Is there anybody that would like to, I'll open it up for public input. Not seeing anyone. I will look online. I don't see anyone there, so I'll bring it back to the board for action.
Mr. Chair, I move to approve the continuation of a local health emergency and order prohibiting the endangerment of the community through the unsafe removal, transport, and disposal of fire debris for the LNU complex wildfire.
Second.
So I have a motion by Supervisor Sabatier, second by Vice Chair Scott. Joanna, please conduct the roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
They said it right at the exact same time, so.
I only heard one. One was close.
Next is 7.10, consideration of continuation of local emergency in Lake County in response to the LNU lightning complex wildfire. And so I know we just talked about that in the other discussion. I think we're just...
Yeah, this is the Sheriff OES Director
there we go.
declaration.
Thank you.
Good morning, and for the reasons stated in the previous item and in support of environmental health efforts to clean up and with the ongoing litigation, the staff's recommendation to consider this proclamation or continue this proclamation until those situations have been mitigated and taken care of.
Okay. Thank you, Sheriff Martin. Is there any... I'll open it up to the board for public, open it up for comment. And is there any public input that would like to be discussed? I don't see any in the board chambers. We will look online, and I don't see any there as well. So bring it back to the board for action.
Mr. Chair, I move to approve the continuation of a local emergency in Lake County in response to the LNU lightning complex wildfire event.
Second.
So I have a motion and a second. Joanna, please conduct the roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye. All right, so we will move on to 7.11, consideration of continuation of local emergency due to COVID-19. Sheriff Martin.
Thank you, Mr. Chair. As has been the topic of many conversations at these board meetings, we were dealing with the COVID-19 pandemic. The proclamation was made early on. It's been continued. It's going to be staff's recommendation to continue it for several reasons. These proclamations allow us to obtain support in response to the COVID-19 pandemic. We're clearly not out of the woods, as we heard earlier in the meeting. We received support as a result of this proclamation in our response at the jail, in our response in the court systems. We received support for reimbursement for testing, PPE supplies, and various operations that are related to that. As long as we still have these expenses ongoing that we're certainly not budgeted to handle on a day-to-day business as a county government, and this proclamation allows us to access some of that funding so we can deal with this and not take away resources from other vital services. It would be prudent and recommended to continue with the proclamation of a local emergency related to COVID-19.
Thank you, Sheriff Martin. Is there anyone from the board questions? Public input? I'll open it up for public input. Not seeing anyone in the Zoom room or in the chambers. Bring it back to the board for action.
Mr. Chair, I move to approve the continuation of a local emergency due to COVID-19.
Second.
I have a motion and a second. Johanna, please conduct a roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
We will now move on to 7.12, consideration of continuation of an emergency declaration for drought conditions. Sheriff Martin.
Thank you, Mr. Chair. The drought is obviously ongoing, and it's predicted it will continue to go on throughout the next year. We heard recently that this is the worst drought in 1,200 years in California. We did not receive the amount of rainfall that we would like to have seen so far, and it's not anticipated that we're going to get enough rainfall to do away with the current drought conditions, and they're expected to continue. I don't know that we have any projects available. However, the emergency proclamation would certainly make us available to any funding that's related to conditions caused or exacerbated by the drought. There's ongoing discussions with the Risk Reduction Authority related to drought conditions that have exacerbated tree mortality in the county. There have been projects that have occurred as a result of the drought in working with some of the local tribes in identifying elevated levels of cyanobacteria in people's drinking water sources when they have systems that draw directly from the lake. So I think it's very clear that we're not done with the drought. We're going to continue to have issues with the drought, and leaving this urgency active and continuing it will assist us in our response.
Thank you, Sheriff Martin. I don't see any hands up in the board chambers here for our supervisors. Is there any public input? Not seeing any there. We'll look in the Zoom room, and I'm not seeing any there either, so I'll bring it back to the board for action.
Mr. Chair, I move to approve the continuation of an emergency declaration for the drought conditions.
Second.
So I have a motion by Vice Chair Scott, second by Supervisor Pyska. Johanna, please conduct the roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Yes.
Thank you.
All right, 7.13, consideration of a continuation of a local emergency by the Lake County Sheriff OES Director for the Cache Fire.
And again,
Sheriff Martin,
as we heard, thank you, Mr. Chair, as we heard from the Environmental Health Director, cleanup is still continuing. We've been requested by the City of Clear Lake to leave our emergency proclamation in place as they finalize their recovery efforts. We'd like to keep this proclamation ongoing in support of the city's cleanup efforts, as well as our own environmental health director's cleanup efforts. So it's staff's recommendation that we continue this proclamation as well.
Thank you, Sheriff Martin. I'm going to open it up for public input. Is there anybody in the board chambers that would like to say anything? Not seeing anything. Looking at the Zoom room. Nobody there. Bring it back to the board. It looks like Supervisor Sabatier has his hand up.
I just wanted to thank staff. I know that we made a request to come back and provide us a brief summary of why these were still on our consent agenda. We've already cleaned off a few and that are being discontinued, which is great. And also now we have a better understanding of what's left over in order to get these emergencies to be completed and off of our agenda. So really appreciate that from staff.
All right.
And with that, if there's nothing more, I move to approve the continuation of a local emergency by the Lake County Sheriff OES Director for the Cache Fire.
Second.
I have a motion and a second. Johanna, please conduct a roll call.
Okay, Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
Thank you. All right, so we got through the through those continuations and declarations of emergencies. Like we talked about, is this a good stopping point for lunch, or do we want to trudge forward?
If your board wishes, I think this is a reasonable stopping point. My estimate is that you may have an hour and a half to 2 hours of additional business with your remaining agenda items, and so refueling would probably be good.
I think that's a great idea as well. It's 12:05 right now. Are we looking at an hour? 1:05? 1:05 sounds good?
Returning at 1:05.
All right. Looks like we'll return at 1:05 for lunch break. Thank you, and we'll see you then.